Changes, and they are for the right input to soak it in. We can't think of a better person than Dr. Ambrish Vijayakar. Over to you, sir.
Am I audible at the back? Yes? No? I'll put it up. Now? Yeah? So, a very good morning to all of us. I think we all had an enthralling day yesterday and a very fascinating day. I'm sure few or almost many of us who are new to Predictive had a sleepless night and started thinking that what is possible with homeopathy. What we are going to focus on today, of course, as I said that yesterday I said that it is our bounden duty and responsibility to carry on the good work of Sir, my father, and try to take it to the masses so that a systemic way of education can be established and every one of us can replicate the same results. So, we have a mixed crowd where we have a lot of young students and doctors and senior practitioners and practitioners who have been following Predictive for almost more than 25 years. So, we'll try to balance the entire session today. What we are going to focus on, what I'm going to focus on is basically only the clinical aspect of what I have been learning with Sir for so many years. I am into my practice for last 15 years, 14 to 15 years, but my connection with homeopathy is since childhood. You can say that I accompanied him to major seminars like this, where I saw him giving lectures, and that really inspired me and motivated me that why can't I give such results. Generally, when you grow up seeing your father giving wonderful results and, astonishing results. But it is something, similar to like Sachin Tendulkar. When you see on the television, he starts hitting sixes, and sixes. And suddenly when you take the bat in hand, you find the ballers are too fast to hit. So the moral of the story is that we need to have our technique well, understand the basics well. So, I am not a teacher or a professor. I am just a pure student of homeopathy. I am learning with Sir. I'll keep on learning with Sir throughout my life. But what I can assure you is I do my basics correct. I do my basics correct. I do not step into his shoes and try to emulate him. I try to walk on the path which is made by him and just do my basic right. So, which has really paid me off, because earlier when I went into my practice, as a youngster, it was very difficult. Mind you, when I remember my initial days of my practice, when patient used to just come and tell me, do not change the prescription of your father, just give us the same medicine. Or, okay, your father is not around, we'll come later. We will, so you're a new doctor, you go there, you sit in the cabin, you feel that you can prescribe somebody, but it doesn't happen so. It is always, it's a gradual process, it's a gradual learning, it's an evolution, which I say that we evolve as a physician gradually. So, I started doing my basics correct, means I started getting those bread and butter cases, cold, coryza, asthma, allergies, etc., where you could, try your hands on and then get successful results and then step on with certain cases, which will go on with many of the young students and doctors who will venture into their practice. Because it's very easy when we see Sir on the stage giving just such wonderful results, so easily deriving at the simillimum. Yes, it is easy, provided we use a methodology. But do not straight away jump to, what we call it alphabet Z. There is always a A, B, C, D. So we need to do the basics correct. This is what I'm going to focus on. I'll share with you that how, by doing certain basics correct, just because we know when we learn, we attend seminars, we attend certain modules, we gain a lot of knowledge, but when it comes to practical application of the same, we are slightly in a problematic situation. So we'll try to make it very easy, very light, so that we all understand. I'm sorry, I will probably have to repeat certain cases which few senior doctors here must have seen those cases for the benefit of the larger crowd. And also those doctors from Kerala who were in Syncona, especially in the SCPH, please bear with me, I will have to repeat some cases. Yeah. So we move ahead. So we take blessings of Dr. Hahnemann, of course, because of him which we are here today, and it's a family. And really to tell you that because of Hahnemann, homeopathy and Sir, we've gone to places, different places in the world where probably people have never reached. So even if with my age of 30, I'm 36 years of age, we've traveled across the globe and seen different areas of the world and the cultures of the world. So not only homeopathy, but you see the experience, because you learn, when you travel, you learn, you grow. And the experience never stops. So all credit to Dr. Hahnemann, and of course the satisfaction which we get when we go to bed at night after coming from the clinic is just because of Dr. Hahnemann. So next please. Then again with my father, my guru, my idol, he's always been a source of inspiration. And it's not only, I say homeopathy, but also in general life. Whenever I required him, he always guided us in the right path. And mind you, he was not a very typical father with me. He was not a very typical father because he knew I bunked my lectures in colleges. He knew that I would not study. I was not a conscientious child as a student. But all the support which he gave us, and wherever we faltered, he always, he motivated me. Said, don't worry, whenever you fall down, get up and fight back again. So this is a great motivation and an inspiration which I really get from him. Of course, I'm learning homeopathy from him as well. So, I always start my session with saying that life is something like a bicycle. If we want to move ahead in life, we have to have a balance, and balance will only come if we keep on moving. So, moving ahead, because step ahead, going beyond, what we learn. Because when we are into college, we do not understand the importance of anatomy. We do not understand the importance of physiology, the biochemistry, the embryology, etc. But when we come out of the college and go into the clinical practice, we really understand that how important it is to understand modern sciences. Because then and only then, because we are physicians first. We are physicians first, then allopaths or homeopaths. So we need to know the interior of man very well. And we are dealing with the precious possession of man, that is life. So if I am treating some individual, I should know what is happening inside. So it's very essential for us to keep moving, keep evolving, keep learning. So those people who are still into their colleges, do not waste those 4.5 to 5 years, because this time is never going to come back. Because when we grow as a practitioner, we are more into the clinics than in our books. Of course, yes, we do have time. We do take time to go into the books every day and learn. But those moments or time would probably never come back. Next. So what we have learned until now, when in predictive, when we start with the basic, we try to share with you the theory of suppression, that how the disease basically moves from ectoderm, endoderm, mesoderm, going to connective tissue, because it is like a radar, it is like a compass for us to understand how the disease moves, because each and every disease in the body is moving continuously. So this is a radar or a compass which is given by Sir to us, that without which we cannot practice. Whether it is an acute case, whether it is a chronic case, we need to see the Hering's law coming, and the Hering's law have to be on the basis of embryology. And this is what we focus on the module 1, that how to understand where and how to gauge where the disease is moving accordingly. So then we concentrate on miasm and pathological understanding, that how you saw yesterday, Sir was trying to correlate the miasmatic process. The miasmatic process are nothing but a defense mechanism at the pathological level, at the cellular level. So how each and every individual is defending itself in a different manner and exhibiting itself in a different manner, and how do we gauge miasm in practical application, or see practically in patients. Because we know, we understand psoriasis, psychosis, syphilis, but when we go in terms of application to patients, it becomes a difficult affair. So miasm is the main base. And why? Because even Dr. Hahnemann said that even over and above the discovery of my Similia similibus curantur, he said the discovery of miasm was the prime. So it is mandatory for us. This we cannot move ahead or cannot go into practice without understanding theory of suppression, without understanding the basic at least of miasms. Then we went to understanding of acutes. That if you have gone through the book of acutes, Dr. Vijaykar chart of acutes, where he, on his 35 years of experience, he mentioned a chart where how do we treat acute diseases. So beautifully he enumerated certain methodology which can be used and results can be got at a single click. So after acute, we move ahead to understanding the constitutional simillimum, what we call as a GCS. And GCS is the basic of predictive, because maximum cases have been solved with GCS. And I am sure those doctors who have been practicing for many years would agree that this is how even Sir evolved. It was he who propagated that understand the GCS, understand an individual, treat the man in disease and not disease in man. When you treat the man in disease, understand the disposition, and he grouped certain dispositions and the remedies and differentiated the remedies accordingly. But as and when he evolved, he faced with challenges, he faced with different cases. That is the time he understood the requirement of the yardstick which we were using. So we couldn't use the same GCS for all the cases, and then he propagated that at different point, at different juncture, according to the physiology, according to the pathology, according to the physiopathology of the case, the simillimum will be required. So once after you understood that, then we focused on immunology, why and how the body functions and how the defenses of the body function, and why it is important for us to know the immune reaction so that we can understand the reversals of disease in a better manner. Then of course, it's the case taking part. It's not the basic case taking part, but what are the attributes which we see during a case taking. So those attributes could be will, moral, intellect, speed, susceptibility, etc., etc., etc. Then, as I said, disposition, mental and physical. So somebody can be an angry disposition, somebody can be an introverted, somebody can be a timid, somebody can be very restless, or somebody can be too aggressive and rageful. So different disposition he, grouped into, and certain remedies he grouped into, whereby if we understand those dispositions, we move near and near to the case. So mental as well as physicals, then mentals of miasms, understanding repertorial rubrics and differentiation, and how to handle soric and psychotic cases. Then soric means all the inflammatory general cases. How do we solve them with the GCS or with the acute chart? Next. And then we say that our practice is only based on these three things: primary, the Hering's law, then understanding the miasms, and then finding out the genetic constitutional simillimum. Okay, jao. So how the disease moves? So what we do with homeopathic medicine is basically we are controlling the regulator. What sir was saying yesterday, the time, that how the disease moves from inflammation to construction and construction to destruction. So what are the attributes of psora? So inflammation, irritation, spasm, irritability, constrictions, colic. These are the attributes of a psoric presentation. So if this is not good enough, so this is again a defense mechanism by the body, and body says if this is not good enough, I need to defend further in a better manner, and body will change its gear at the genetic level, and the same inflammatory or the spasmodic tendency gets converted into more constructive, accumulative, proliferative, over-functioning or under-functioning of system or organs. So this is how even body is so intelligent. Body is intelligent even than the physician. That body is trying to defend. Oh, he doesn't understand what is happening. So let me change the gear and go higher and higher. When this gear is changed, even if this is not good enough, then the body will shift its gear to the tertiary level, giving rise to destruction, ulceration, bleeding, cracks, distortion, perversions, etc. This is that was more at the general level, and then at the mental level, when we say the same thing, that irritability gets converted into fear and cowardice, and the cowardice gets converted into either perversion or out of control. So Sora, there is love for life. In psychosis, there is love for life, but in syphilis, there is no love for life. So what happens is generally that when we try to assess a case, almost every case comes to us, we take the history and the patient says, oh, everything is well, sir. There is no, how is your nature? And the patient says, sir, my nature is good, nothing wrong with my nature. All is well with my nature. And then we say, oh, he doesn't offer me history. How do I go about it? And then we try to probe with the relation, we try to go ahead and see how did he come up in life, was he really studious, not studious, and what is the kind of job he is doing. So we try to collect as possible information from the surrounding. So what we get is the information, the basic information, yes, correct. But what is the information which is projected by the patient is generally the psychotic information. Because nobody will straight away come and tell us that I am good or I am bad, or I am doing this the bad thing, or I am doing a good thing. So it's a very, very dicey situation, because all the information, yes, we need to collect it, but we do not really depend upon that, because what we see is the basic Sora been going into psychosis, and the psychosis is always on the larger sum. And most of the time, this is what the picture we get along, whether it is a soric case or whether it is a psychotic case. So, as sir was speaking yesterday, that yes, in a soric case we can give the GCS, or in acute soric case we can give the acute similimum. But as the case is moving on, when the case is moving on, the soro-psychotic, when the dynamism is still there, if the case is not, accumulative tendency has started, sugar levels have started to elevate, diabetes has started, the blood pressure has started to elevate, thyroid is started to elevate. There is some dynamism which is happening. The patient is predominantly in the psychotic phase. And these are the cases which we normally as a physician encounter in the initial part of our practice. And then it becomes very difficult, because the most difficult miasm to penetrate is psychosis. The most easiest miasm to treat is syphilis, because the symptoms are evident. The symptoms we get if you can probe in the right direction, you get the symptoms, we can enter the case and the reversal can happen faster. But with psychosis, it really, beats down, and we need to, bang our heads to get the exact pivotal rubric to enter the case. So psychosis is something which is very, no miasm is good or bad, but psychosis is the most difficult thing to enter, and which is very obvious, which the patient is giving us or projecting to us. But now the art and the challenge will be to go through the psychosis. Penetrate the psychosis and go beyond to see whether the psychosis has a danger of lurking syphilis behind. And these are the psychosyphilitic cases I am talking about, where the general psychosis, that means the mesodermal diseases, where we have cartilage problems, where we have cardiovascular problems, we have problems with proliferation, we have problems with accumulative tendency. So when the body has shifted the gear, the body is gone into that mode, it becomes for us important to know that there must be some syphilitic or trait which would be lurking behind, and which probably we are missing. And what happens is, here we prescribe the similimum, the patients get better for certain time, and the reversal starts. The patient improves for 6 months, again the patient deteriorates. The patient improves for 1 year, the patient deteriorates. Then we try to give 1M, 10M, 50M, it doesn't work. because the entire focus for us is the psychosis. Go ahead one. And this is the red part, the red tip which we see is behind is the syphilis. So psychosyphilitic cases are the most difficult one because penetrating, going right from the sora to the syphilis becomes very, very important. And of course, when we hit we catch the pivotal syphilitic trait, the upper red one in the hands, and when we go down and find out, the psychosis automatically gets matched. And the psychosis automatically gets matched, and we need to hit the sensitivity of an individual to find the psoric trait. I'll come to that when I take a case next. So approach to various cases. So what I am going to today focus on is few psychological cases. You know, initial days of my practice, when I used to get some kind of these cases, psychological cases, it was very scary. And it was a challenge because you don't know how to handle them. But it is a very important thing to understand that if certain things we want to learn, and you know these cases are coming back to you again and again, probably the Almighty wants you to learn something from the case. You know, they keep on sending difficult cases. So I used to ask, you know, you don't have any simple case of a thyroid, asthma or a skin problem, you sending all big things. And that was the challenge because sir was not available in the clinic. So by default I used to get those cases. But then, you know, it's very important to learn from the situation as well, that why these cases are coming to us again and again. There is some teaching to it. And then I tried, of course I failed a lot in my initial psychological cases, and of course now also I fail, but it's an encouraging results. I have at least a path. I know what path to walk on. But those days it was not really very clear that what and how I should go about it. So what I'll just throw a light is what should be the approach, because there are varied type of psychological disorders, the very type of emotional disorder, the very types of behavioral problems, and when we go higher and higher and higher, the problems even going up to dementia, Alzheimer's, and going into manias and hysterical behaviors. So what happens is, you know, as Dr. Hahnemann has mentioned about one-sided disease, and so what should be the approach in the one-sided disease? Because it becomes very difficult, because when the disease gets evolved in a higher and higher level, the mind gets evolved or goes out of control in the higher and higher level, then probably the mind symptoms are one which we cannot consider for prescriptions. And you see a lot of common symptoms coming up, a lot of common elements which are coming up. Rage you'll get hitting, you'll get biting, you'll get maniacal behaviors, you'll get restlessness, etc., etc., etc. So when we just take those disease kind of symptoms for repertorizations, we will only get common remedies which are coming like tarantula, belladonna, etc., etc. So as Dr. Hahnemann has mentioned that yes, if an insane person goes berserk in front of us, when he's really violent and berserk, what we can think is controlling them by Viratrum album, belladonna, such specific drugs which are able to control them. But if this is the process which continues again and again, then there is definitely something wrong with the basic genetic character. Because why and how is he going into repeated episodes? So controlling, yes, we can control with that specific drugs to get that person into control. But if it recurs, it is something like a tree. If the tree is recurrently falling, if the building is too weak and the building is recurrently falling, I cannot just use a brick work or a cementing work to concretize the building. I have to go to the foundation and repair the foundation. And this is very, very important in psychological disorders, where maximum times we prescribed on the eminent symptoms which were coming. So somebody who is having rage, who is just coming and biting, who is having a very shocking behavior, ruining his clothes, we attribute and convert into a rubric and prescribe a remedy. But then we realize this mistake, that this will help us on the temporary pattern. But what about a permanency? What about to stop the recurrency? We went into the details and understood how should be the approach be. Pudeda. So when we have this general question which are coming to our mind is, should I use a specific? Should I prescribe only on physicals? Should I prescribe on mind? Or should I take only few rubrics which we know, insanity, in panic attacks, mania, etc. Then what potencies shall I use? Sir, generally they say that you should use higher dilutions, 1M, 10M, 50M, or can I go low? And should I trust the mental history or the in a case of mental kind of insanity, or should I consider the ailment for an insanity? So these are the varied questions which start hitting our mind, that how and where can I hunt for the history and how should be the approach. Next. So, as Dr. Hahnemann has mentioned, that so-called mental and emotional disease are nothing more than a corporeal disease in which the symptoms of derangement of mind and disposition peculiar to each of them is increased, while the corporeal symptoms decline gradually, more or less rapidly. So physical symptoms decline gradually or rapidly till it at length attains the most striking one-sided, almost though it were local disease. So many a times which we see that the disease will travel from ectoderm, the mesoderm, the endoderm, and suddenly the person starts getting too much irritable, too much angry, gets disassociated and go into a maniacal behavior. Or for that matter, certain cases where they're taking anti-tubercular line of treatment, either respiratory or abdominal, and suddenly the gear shifts and the patient can go berserk. So certain diseases, local and physical diseases, can go slowly down and giving rise to an acute inflammatory or acute condition at the mental level first. It will be SORA, some exhibition of SORA, and then jump suddenly into a maniacal behavior, where he said this would be the local one-sided disease. Invisible, subtle organ of the mind or disposition. Next. Azun pudeda. So there are two types of disease which Dr. Hahnemann has mentioned. One-sided disease is corporeal and non-corporeal. So just let us understand what is that. Go ahead. So corporeal, as I said, from corporeal disease, body becomes syphilis and then the mind follows. So, the mind and body axis is very important. Mind and body speaks the same language. So whenever the disease is attacking the physical and disease is going higher and higher into embryological origin, the individual stand a chance to go into a psychological or psychic problem if the disposition need be. If the disposition has that attribute inside it. And this is a condition where, certain, especially children, small children, they go from SORA to psychosis very quickly, and lot of allopathic medications, lot of antipyretic, lot of anti-inflammatory which has been given, and suddenly the mother says, oh, my child was such a mild and calm child. And suddenly now the child has lost control and he starts becoming restless, he starts going and handling things, taking things from anywhere, and the control is getting lost somewhere. The control started to get loose somewhere, and this is the beginning where the body is trying to indicate that now the disease can threaten to go from physical to mental. So this is only the beginning part. If it is allowed to move, the child can get into dissociate or behavioral disorder pattern as the child goes on going. Of course, it also has to do attribute to lot of trauma. We'll come to that when we take cases, but it is lot of children nowadays are going through this mental trauma. What we do not know about it is that the trauma could be exhibited. That means that it could be reflected or it could not be reflected, depending upon the sensitivity of the child. And in today's world, where the mothers are more workaholics, they want to work more, they want to go to the office, rather sit at home and feed the child. So first 3 to 4 months the baby is fed, and then suddenly the child is not given the breast milk. There also is a trauma. So that also is a injury. That also is a primary sora which gets injured and then get reflected on the body somewhere. So as and when the child grows up, it definitely has an attribute, mental attribute in it. And when still it goes further and further, he sees a certain conflict in the family which are happening. It could be with the parents, amongst the parents, the father and the mother. It could be amongst the grandparents. It could be the daughter-in-law and mother-in-law. This carries a lot of imprints on the child. And hence it is said that the brain or the mind of the child is so receptive that if you have a small children at home, you should never even raise a voice in front of them when you are fighting. Because that you never know what can grip which, what is the constitution which is lying there, whether he will take it or whether he'll reject it. So that primary trauma which the child goes through, the child is absorbing, is nothing but the child is nurturing into going into psychosis at a very early age. And this psychosis or this precocious condition of the child, if the child has predominantly syphilitic traits in him, can land up into deeper physical problems or deeper mental problems depending upon his disposition and sphere of action of the body. So it is very, very essential for us when we take a history, especially of children behavioral disorders, we have to attribute and take the entire history right from the childhood, that how was the mother, did the mother really fed the child for 9 months, how was the treatment, who was he with, was he with the maid, was he with the caretaker, or the babysitter, which nowadays they have a fad, or how was the child with the grandparents at home. So each child has different needs, each child has different biological needs. It could be love, support and esteem. If these three biological needs are not met within, because normally what we feel is just giving the child gift or getting the child. If I am the father, I reach home, I have 2 children, if I just take certain gifts and give it to them, that doesn't mean that I am loving them. Because for them, love is my time. For them, love is my caring. For them, my love is my attention to them. So if I'm not doing that correctly, what is their requirement? If it's another constitution, it's not a constitution of love, then it would be the esteem and the respect. Dad, you did not come for my annual day. Dad, you did not see me dancing on the stage or performing on the stage. So I will remember it next time. So certain traits, certain time, these children, even the smallest of children, as they grow up, they remember and have this in their mind. It not be relevant at that particular time, but it is sowing a seed for the plant to grow tomorrow, where the plant could go into a psychological or an emotional or a behavioral disorder. So then taking and going to the roots and understanding the history in a deeper manner, that what was the need, what was the sensitivity and what was the trauma of the child at that particular time when he was growing up, which could be sustained for a longer time or which could injure and the child went into psychosis. So it becomes very important there even to understand whether the child really went into psychotic mode or the child is still into that soric mode, taking the trauma. That develops the child nature. All the nature, what nature we are today, what nature we have developed today, have to have attribute for us in our childhood, in our sora. We all are a projection of what we are. But what our nature is, how our nature is the trauma which every individual, so it need not necessarily be that the individual land up into a mental problem, land up into a psychological problems. But this trauma has to be there at a particular pattern when the body shifts its gear and when the immunity of the body is not good enough or not correct enough, then and only then, or what we say is the sora at the mental and at the physical level is sacrificed, disease will be exhibited. So primary attention for us to know that where the body is, whether the body is into sora, whether the body is into psychosis or whether the body is into syphilis, because that will gauge. It's like a radar to gauge where the disease is going. So mind and body speaking the same language. Body into psychosis, mind also has to be into psychosis. Body into syphilis, mind has to be into syphilis somewhere. So when we say the corporeal disease, the body becomes syphilitic first. All the syphilitic ailments start hitting the body. All the destructive disease start hitting the body, and then the person start going into insanities, mania, etc. Put it up. So this is how we called Dr. Vijaykar's chart of suppression. They climb up the ladder from the ectoderm, endoderm, mesoderm, again depending upon the genetic trait of that individual. If it is a syphilitic child, Sora will immediately get converted into syphilis, and then straight away he'll land up into severe and major mental illnesses. So these are the corporeal diseases which Dr. Hahnemann has mentioned, that the bodily disease start rapidly or gradually, slowly over the period of time can recede, giving rise to one-sided illnesses. And it becomes very important to know that when we stimulate or when we give the right stimulum, when the body improves, we might or we will get these bodily disease back again. So somebody going into insanity, especially those people, or somebody going into depression, chronic depression for a longer period, anti-thyroid drugs. If you see maximum ladies who are taking anti-thyroid drugs, they land up into chronic depressions and panic attacks. So when this is reversal, the disease is reversing, we see the thyroid levels transiently going up somewhere. We see the sugar levels going up somewhere. We see the cholesterol or the blood pressure going up somewhere in order of importance. And then coming down to the mesodermal and endodermal or ectodermal diseases. But the other side is next. And what is that? So the disease, physical disease, goes to the mind and becomes syphilitic, uncontrollable, unbalanced, and maniacal behaviors. Next. It could be medicinal suppression, it could be progress of the disease, it could be varied reasons, it could be trauma, how the child has faced in the childhood as well. But there are certain cases where the mind is already imbalanced. The person is already into a syphilitic state, the maniacal state, an insanity state, and then the patients suffer from heavily, severely bodily diseases. This also is a kind of a condition where the mind is into syphilis and then body follows, and these are more dangerous because mind is the orderer and body is a follower. So when this disease occur, they are generally more destructive and more high grade. So even the leukemias, certain insane people suffer from leukemias, which are very fast moving leukemias. So this becomes a very fast affair, more destructive affair, and a more serious affair. Down there, and of course, more important also is this mind has taken certain attributes. It's very important here also is the mind has taken these attributes and the mind has gone into syphilis so fast because the soil was so. Because the constitution was so, because the disposition was so. For example, there are 10 drug addicts, and if a good boy is kept in that 10 drug addict, sometimes the boy might not turn into a drug addict. Or if he's a good boy, he falls into a bad company, he'll not necessarily go into a wrong line or lack of morals. Why? Because the genetics of the child is very, very strong. It doesn't allow the boy to go into syphilitic sphere very fast. But for that matter, those individuals, the genes are so, how Dr. Hahnemann has mentioned that the certain species which are passing a trait to the progeny. Dr. Hahnemann has also mentioned about genetics, but of course he said that they did not have the electron microscope at that time, and it was only an assumption that certain traits are passed from generation to species, whereby having an imprint on the genetics. So if the genes are corrupt, then the individual might suffer or will go in and fall into wrong company and bad habits and morals. And that is the reason, very, very important, that all the people who commit suicide, all the people who go into, going into killing of people, going into, hitting, killing, vulgarities, and all those nonsensical, difficult and dangerous things, the seed is in the childhood. The genes are very, very important. How the child has been brought up, where the lineage of the child is, brings about his future. So these people are diseased individual, because right from the childhood you can make out certain children, they like to play with toys. Certain children, they like to play with cars. But there are certain individuals who only will play with guns and knife. If you recollect, they will only play with gun and knife. They will only do dishum, or kill individual, and they only go into hitting, and they make sure that even they will take a cockroach and kill it. That is the amount of syphilis which is there in them. That is a lurking. That is the genes. That is, they get. It is something, I would not say a sadist, but a satisfaction somewhere to hit and kill an individual. But that is a trait which is there right from the childhood, which gets developed, which might go into this or might not go into this. But that is a trait that would carry this individual going into bad morals and corrupt morals and land up into grave diseases. Even for that matter, suicidal dispositions, which is autoimmune, what we say. So there has to be some either going from physical to mental. I had this thing very, very recently with one of my friends in the family, that an individual, a lady, committed suicide, and what was the reason behind it was that her son failed in 5th standard. Her son failed in 5th standard, and she committed suicide. So it was, what would be the reason? Such a small reason, and somebody commits suicide. So the soil was so. The soil was syphilitic, highly syphilitic. The lady was hysterical. But hysteria, if the lady has gone to hysteria, either the stimulus of the mind was constant, the trauma was constant, that somebody must have put her down, or she was suppressing her physical ailment. And I just happened to talk with that friend of mine, and I found out that she was taking treatment for local piles. She was taking treatment for acidity. She was taking treatment for joint pains, and she was continuously on allopathic suppression. So how dangerous it could be. It need not necessary that allopathic or any suppressions could land up us into a physical grave diseases, but it could also land up into a mental, psychological conditions which could take us to the brims of syphilis. So it is very, very essential for us when we are probing in the history also, whether the individual, because we just ask, how is the anger? How is the anger reflected? Do you express your anger? No, not. But the episodes of anger, the episodes of rage, how are they exhibited right from the childhood to the present age? Because there is the main pivotal thing which lies, that expression of certain anger and irritation will be very, very common at smallest and trifle things. And if this is there, that we know that this lady has certain hysteria or hysterical traits which can land up into problems. So this is only one faction of it. So hysteria could be different reactions. Hysteria could be taking different vibrations, taking different reactions, or hysteria could be different actions as well. But at different factions, you will find the lady going into high grade syphilis. So this for us becomes very important to understand, from body to mind, and from mind rather because of the corrupt genes, because of the faulty genes or the non-conscientious genes, which we can say, the disease can move faster and go into bodily disease. So how do we handle that? What are the types of disease and how do we handle that? And we'll also try to solve certain cases here. So generally we have anxiety disorders, then we have depressive disorders, which are, I'm talking about the acute depressions. Suddenly somebody dies, some bad thing happened in the family, and then immediate thing which affects is an acute depression, an acute emotional outburst. But as it goes into more chronicity, then we need to hunt for a more deeper and higher grade rubrics. But depression, panic attacks, certain phobias, mood disorders, behavioral disorders, sleep disorders. So in such cases, certain sorosyphilitic conditions could be given importance to. As sir was talking yesterday, that these are amplification of symptoms. These are amplification of certain symptoms which could be elevated, we could catch hold of them and enter the case. But with this, with the expression of sorosyphilitic symptoms, if we can get certain generals or particulars, high grade general or particular, it could be in appetite, it could be in sleep, it could be in perspiration, stools, it could be in bleeding, etc., which is very specific to the character, to the disposition, then we can get hold of. Either it could be a general or it could be a syphilitic particular. Of course, we'll not talk in detail about general and particular, but when it is more to do with the miasmatic reflection with a constitutional trait or the trait of an individual, we can take it as general. And more when it goes deeper and deeper and deeper to a level where it becomes a deeper concomitant, then it can go to a particular which is apparently unrelated. So one is the sorosyphilitic symptoms which we can take. One is some grade syphilitic symptoms which could be general or which could be particular. But very importantly here is the sensitivity and the need, which is almost everywhere in all the psychological cases. So sensitivity and the need of the drug will attribute where the child has grown or where that girl has grown particularly. We go one step further. When you try to handle the OCDs, either first they are in the thoughts or they are then into washing of hand, cleansing of hand, and all the actions which are repeatedly done. So bipolar disorders, certain addictions, very, very important. Now, I don't know here, but in Mumbai, I'm very sad to say that there's a lot of addiction for the weeds among the youngsters. Really sad. And now they feel that it's a fashion. It's a fashion and they are going into this. This is high grade syphilis. It's going to destroy the young generation. They do not understand. They like to be in that high. They like to be in that kind of mode. But this is highly dangerous and destructive. Chronic depressions here, patients, or patients going into homosexuality, tribadism, or lesbianism. Very, very sensitive topic. Generally, we don't speak this topic when we are speaking in Europe and Germany, because they do not like talking of homosexuality. They do not believe that it is a disease. They believe that it is a gender right and it should be given to all the genders if necessary. But when we understand miasm, we as a homeopath, we as a predictive homeopath, when we understand our miasm to the core, that homosexuality is a disease trait. And homosexuality starts again with the trauma in the childhood. You probe all those cases of homosexuality, all those cases of tribadism or even in lesbianism, you will find the trauma to be in the childhood. One step ahead you still go of homosexuality is then when the individual do not understand whether I am a male or a female. Am I a male? Am I a female? It's the two factions to it. One is the individual could be syphilitically effeminate. He could be syphilitically effeminate, but that does not mean that he is a homosexual. But that does not necessarily mean he is a homosexual. Mind you, there are a lot of males who do not look like homosexual, but after they get married, when the wife knows the entire interior part of it, they go for a divorce, and then she comes to know that he is a high grade homosexual. So effeminacy has nothing to do with homosexuality. Homosexuality is a disease interpretation or representation of a miasm because of the trauma which is got in the childhood. But one step ahead, when this goes one step ahead, there would be identity loss or a crisis where the individual does not understand whether I am a male or a female. I had a lady who was coming to me where when she came inside, I couldn't make out whether she was a male or a female initially. And her friend had got to me. Why? Because she had started getting attracted towards her friend physically. She was a female. And her bodily, see how mind and body will speak the same language. When she showed me her initial photograph of her, that she was so effeminate, she was so beautiful, she was very, very girly, and that, what a feminine lady should have. And then now I see her with broad shoulders, broad face, puffy face, eyes which were very malish, the cheekbones which were very malish, even the voice, the tone had become that much malish. And then she says that I am compelled to, I don't know, but I am compelled to like towards my female counterpart. I am getting attracted towards my female counterpart. Where certain times she had a husband, she had a son as well. And they were not in good terms. Husband was not in good terms. So when I went deep inside the history, I asked her, tell me what since when is the problem? She said, I have never been well since my marriage. When I got married this man, I had never got respect. I never got, what I wanted. He never gave attention to me. I wanted that attention and respect. I wanted even care from him, but I did not get. Everywhere when I had to say something on business, I had to talk to him on business, he did not allow me to. He was very strict. His father was very strict, so I had to keep quiet. I don't say anything. He only comes and criticizes me that you don't cook food properly, you don't keep house properly, you don't do that. It's only when he requires sex he comes to me. So I have lost interest in him, and I don't want to indulge into extramarital affair, and hence I want to go for my physical satisfaction, I want to go and land up having a sex with a lady partner. So because she did not want, because she did not get certain biological need, and because she did not want to go with a male partner, she started attributing herself and having attracted towards female partner. So she says, I don't know. Sometimes I wear like a female, sometimes I wear like a male. Sometimes I wear like a female, sometimes I wear like a male. I went back in the history, the Soric history. I found out the same history. Why? Because the father was also same like the husband. She never had she was a kind of a girl who was a very, very sensitive girl, a very emotional girl. She wanted family together. She never wanted, too many people around, but she wanted basic family to be there. And she was a person who would, come and talk to and just vent her emotions. She wanted that never with her parents, never with her in-laws, never with her husband. And the husband even scolded her in front of her son. So everywhere you see that she was suppressed. And finally she landed up into conflict of male and female, and that is what we call as confusion of identity. So she landed up into confusion of identity, that what am I, whether I'm a male or a female. And this attribute generally you see with women who go into PCODs, women who go into amenorrheas, women who go into menstrual problems, or menses coming and going, coming and going, coming and going. They start getting masculine. The hair follicles, etc., the hair growth, etc., start happening. This is a gear which the body is shifting, body is changing, depending upon what she is inheriting. Of course, she reversed back very nicely. I gave her natrum muraticum, and they were about to get divorced. She was on the verge of death. She said, "Sir, this is the last chance I have come here. I'm about to get divorced with my partner because I cannot stay with this man anymore. You tell me what can I do for it." I told her, "Just wait. Give me a few months. If my medicine, our medicine is correct, you will not divorce him." And then he said, "What your medicine has to do with my divorce?" That was the question she asked me. But this is 100% true, that if our remedy is correct, our medicine is correct, as Sir was speaking yesterday, this is a divine power. This is a positron energy. This is a dark energy, what we call as, then nothing wrong can go. Because all what we do is an immunomodulation. If your immunity gets good enough, your immunity starts coming up in the right direction. Whatever the graha stars are speaking, whatever Rahu Dasha and Shani Dasha you have, will never start affecting you because your immunity is got strong enough. And it did happen that initially, within I think 15 days or 20 days, they had their anniversary. They celebrated their anniversary. They celebrated their anniversary. And then we could definitely see certain lipstick coming up on her face, some feminineness coming on her face. Of course, the body will take its own time to come down. So this is a reversal of syphilis to psychosis, how it can come. But this is just an example to tell you, this is one of the case. Then another case which I had was a boy who was high-grade homosexual or a perverted homosexual. I could say a perverted homosexual, where he could not live without having a sex with an animal. And he said that it was very difficult for me to get, but then I find a male partner and I believe he's an animal and perform sex on him. So that is the amount of syphilis the individual can run through. But this is only the sphere what we see. And we cannot enter from homosexuality or tribadism. Yes, there are certain group of remedies, but we are limiting ourselves to it. Because we did that, we entered into it, we prescribed it, worked, it didn't work. But why? The first place, why did he go into such problem is very important, rather than what is the problems. Because why, if we get answered, that will give us the sensitivity, that will give us the seed, that is the soil which has taken to this kind of nature. So, very, very important. Homosexuality, tribadism, lesbianism, perverted sex, because now it is increasing among a lot of youngsters. The Western culture which is taking place into, and going into duality conflicts and confusion of identity. So how do we understand that? Here, no sorosyphilitic symptoms should be taken. Because Sora, the amplification of symptoms will find in it, but no sorosyphilitic symptoms, because it will only cover the physiological state of mind there. So what is important is the high-grade syphilitic symptom in the mind is very important, very, very important. So it could be imagination, it could be fantasies, it could be memory, it could be art, it could be any faction, it could be, output of the brain, input of the brain, processing of the brain. It could be any faction, but high-grade syphilis should be taken. And then, of course, SORA and the trauma of the child is very important. Maximum cases of confusion of identity, maximum cases of homosexuality will have trauma in the childhood, or for that matter, those individual, male or female, would be abused. Would be abused, and family abused is what we get very, very common. The ladies do not open up, do not come out, because either the uncle, either the mama, either the chacha who is at home has somewhere molested or abused the lady. The trauma remains, the trauma builds in the mind, the anger builds in the mind, and the hatred towards an opposite sex or individual starts from there. So very, very, very important to know that where is the trauma. Because in the history we forget, or rather we have a culture, we do not venture into sexual history, or we venture in a very, very superficial manner. But hence Dr. Hahnemann has said that do not ask direct question. Get the individual to that level, get that patient to that level, to that platform, and then you question directly. If you ask somebody whether you were abused, anybody will say no, straight. What nonsense are you talking about? But tell me something about your childhood. Tell me how was your childhood. Tell me where you lived, who lived in your family, how were you looking as a child, who was close to you, did you stay alone in the family? No, this is a build-up to the history. So when you reach that level, then you question and probe that individual particular manner. But very, very important, maximum cases who land up into these problems have to have trauma in the childhood. Have to have behavioral problems, ODD problems, rebellious behaviors, children who defy doing anything. They just don't do. It's only anger. That's the trauma, or the normal, faulty genetic inheritance, which gets blasted there, and they land up into high-grade syphilis. So if you get syphilis, get SORA, automatically the psychosis covers. And in psychosis, you will find a lot of sexual history coming up. And the maze of psychotic symptoms, maze of sexual symptoms, we go and land up into sexual drugs. That should not be the case, because these are the pointers we automatically follow and that we go and do, without understanding that what has gone wrong, when it has gone wrong, and how it is developed in this boy. We go one step further, then we go into schizophrenias, we go into dementias, then we go into high-grade homosexuality, perverted homosexuality here, and high level of insanity. Very, very important, where we could not give importance to mind, because insane people you cannot trust. You cannot ask them, how is your nature, how is your mother's nature, father's nature. No, you cannot ask them. They will hit you, they'll kill you. They are in no mood of talking. They cannot understand what is there. They have no orientation. So it is very, very important that either you have, because there are certain traits when the individual go into that syphilitic sphere of disease, high-grade insanity, or a pathology going into insanity, where the individual reflects certain actions of the constitution which could be peculiar to the constitution. And these actions should be picked up and should be tried to convert. If this is not the case, then we go the normal way of understanding the trauma and then pick up the bodily syphilis here. There it was the mind. We can trust the mind somewhere in the OCD, in all those addiction problems, where you can trust the mind. You can still enter through the mind. You can convert the mind. But when the body has gone beyond, or rather the mind has gone beyond the control, then we cannot trust the mind. Then it's the body which is important. As sir was also talking yesterday, if the pen is there, if something is falling from here, I cannot lift it from here, I have to pull it from here. So I need to catch hold of the body. I need to catch hold of the body. Whatever symptoms the body is giving has to have or will have an attribute to the syphilis in the mind. And with that pivotal entry point, if I can take the enter to the case, I understand the trauma. Many of the cases will get solved until here also. But now recently, which we have learned from sir, and he's also evolved, as I said, he's evolving day in and day out, that we've understood that certain diseases which are happening in certain individuals are because of inception and ingression of certain wrong perceptions or certain wrong thought processes. So many cases who run towards the schizophrenia, who run towards hysteria, I have not mentioned that, very, very bad hysteria. Those cases have to have some lurking wrong perception in them. And that wrong perception is nothing but a chronic delusion. Mind you, a chronic delusion where the body and the mind start behaving and enacting accordingly. So when I say chronic kind of delusion means, for example, the certain ladies who do not get love and affection. They are very conscientious and diligent ladies, but they have a lot of anger towards their partner and a lot of insecurity towards their partner. But still, as they grow up, they have certain fears. Certain fears are also not good enough, and then they start suspecting that nobody loves me, nobody cares for me, nobody really wants me. So that is a delusion which starts affecting her. Delusion, I am unfortunate. Delusion, I am neglected. Delusion that the world is causing problem to me. So these are certain chronic delusions which develop and develop and develop, and then land up patient into a schizophrenic condition. Because majorly when you land up into schizophrenia, your patient goes into paranoid schizophrenia, we only think about destructive remedies. We only think about high grade mercury, cephalinum, tarantula, belladonna, etc., etc., etc. Because, sir, there is a lot of violence. But that is an attribute of the miasm, that is an attribute of the disease, that is a symptom of the disease, that is the expression of the miasm. But what is the constitution? What is the yes, the constitution can reflect certain symptoms when it is going to this kind of disease. But what is the linkage? How is the linkage? Why did he go into rage? And then you find that certain remedies we can not have thought about. I'll see if I have that case. I have shown that case in SCPH Kerala, where there was an insane girl where she was unaware of what she was doing repeatedly. Let me see. Rucha इधर. So can you see her? She's talking, she doesn't know what she's talking. She's dancing like this. And then one more video.
बस
Oscar. So now such kind of cases, what history can we get? She is in no control. This was a normal thing what she was doing. Imagine the plight of the parents. Unfortunate parents. I have few videos where she was tied down and kept in her house because she was very restless and she would go out anywhere. But we as a homeopath has to be a keen observer. We have to be a keen observer. Even with this state, we need to understand that what is happening with her. How is the reaction? What is the reaction? How is she defending herself even with the disease disposition, even in a disease condition? Very, very important. How is the build? The build is strong build or obese, right? Or chubbily built. So definitely we want a constitution which is rather not strong but obese. But why a person becomes obese? What is the base of obesity? What is the base of psychosis? Is the base. And when you say psychosis, it is the insecurity which is the base. So whenever an insecurity sets in, deep insecurity is the base of psychosis. Fear is the base of psychosis. So whenever an individual is switched on into gear of psychosis, he will go into obesity and generate fat. So kind of a girl who was going into obesity, this is a defense mechanism at the mental level. But how was she defending? Was she aggressive with her mother? She was not aggressive with her mother. She didn't go and hit the mother. She defended herself. This is what I was trying to tell you. That every disease individual action zone also will be with the constitution. And this would be important for us. I do not say that take the disease symptom. But how is the reaction of the constitution are telling me something about the constitution. Man karo isko. Do you get me? Right? So it becomes very important for us to understand their reaction. So this is a timid girl. This is a girl who does not rebel, does not revolt. And this is a girl who has a lot of insecurity in her. Of course, we'll not go into the entire case. This case also is a long case. But the whole history started when they were staying with her. The family was staying with the grandparents, and there was a separation in the family which happened, and they got separated from her grandparents and they shifted to a new house. So as soon as they separated from the grandparent, they shifted to a new house. The child started to fall ill. The child started to have problems. The child started developing problems. This problem went gradually up, and then she landed up into severe kind of rage and maniacal behavior. So Sora was separation. Sora was love. Sora was family. Sora was bond. So she wanted bond, she wanted love and affection, she had attachment to her grandparents which was broken. This is what I was trying to tell you. That maybe we not come to know the importance and understand the importance of what was the injury then. But when the child grows or the girl grows up, she end up into going very, very hysterical and syphilitic behavior. Go back to that slide. अपना ये हाँ नहीं ये हाँ नहीं किधर गया वो अभी लगाया था ना हाँ इसके बाद ये केस लेना ये है ना ये खोला है मैंने इधर ये So we'll go for a case now and try to understand the case, try to apply what we have learned in this theory part. It's all about application because it's very easy for us to grab it, to take it, but when it comes to cases, we see how we can apply it. So this was a lady, ये दिखाओ ना खाली, ये dementia final, और उसका PPT भी खोलो, PPT खोलो और उसके नीचे भी है, उसका एक वीडियो बताओ पहले. फाइनल डिमेंशिया फाइनल हाँ हाँ बताओ. So her family reported to us, she was not here, she was away from Mumbai, and she used to go berserk, she used to undress in front of people, open door, go out anywhere naked, she lost complete control. This was a video taken on a mobile by the daughter-in-law. And of course, she had many physical ailments which she was taking treatment for. She had knee pains, she had gastric problems, she had a lot of problems which she was taking treatment. Gradually this again as this suppression happened, the disease went from less important to more important, and she suddenly landed up into going berserk and started losing orientation. She started losing the course of her, she did not understand who was she, who was her relation, what was the time. Complete disassociation was there. So this is a video she taken when they had left her, because they had to tie her up, keep her in the house, because she would open the door, go out of the house, go in front of anybody, next door neighbor, and remove her dress and stand there. She did not understand what was right and what was wrong. And full time she would go on giving bad words, all the worst of bad words which they speak on the road, she would narrate to people. Go to the PPT. So we'll just try to run through the case in a short manner. Lakshmi. So dementia, almost 3 to 4 years she was suffering from, but it got worse and worse day by day, and she doesn't know where to pass urine, during the day properly, where the toilet is, she gets confused, where is the kitchen. She even in the house she started getting confused, where is my bedroom, so this confusion also started increasing gradually. Next. Her appearance was lean thin since childhood. Appetite was less, now has started losing more weight in spite of having good food, but there was emaciation. She liked non-veg, she was chilly, she was thirstless, she had constipation, very much offensive nowadays. Her urines were also very offensive. Her perspiration was scanty and very much offensive. At present, she is keeping her eyes closed. She doesn't sleep at night. She is very restless. She doesn't eat at odd time. She would ask for food and then later refuses to eat. She doesn't realize that whether it is a day or night. She doesn't remember whether she has taken a bath or no. She would crawl in one room at night and she would wake up people in the house. These complaints have started more aggravated rather than in 3 months now. And present she removes her clothes and goes naked outside the house. So this dissociation started maybe 3 to 4 months. Then, of course, nothing significant here. Next. She was very much dominating in the house. So I tried to take the history from the daughter-in-law who had come with the video, because she could not come. She was very dominating at home. Everyone would listen to me. Whether she is always right, never accepts her mistake. She would decide what is to be prepared at home, and if any time anyone says that there is less of sugar in any dish, she would say that the sugar is not proper. She would not accept her mistake, that she will say that the sugar is not proper. She would speak the time when everyone should sit and eat. The daughter-in-law said, "Sir, nobody can challenge her. If she said 12 o'clock, everybody has to be at the table at 12 o'clock. If anything new is bought at home, then he would be given first to her. If not done like that, then she would get angry and won't talk to anyone. Everything should happen according to her will. She would fix the time to eat, what her daughter-in-law would wear and buy. Doesn't like guests at home on the first day. She would behave normally on them, but on the second day onward, she would not talk normally to them, and purposely make bad food at home so that they go away. So she was a cook as well. And if someone contradicts her, she would get angry and she would not talk to anyone and would eat in anger. So she was a lady who would get angry as well. She continuously worked at home, doesn't like to stay idle. She does not allow her servants to enter the kitchen. She's very possessive about her children. Even after her marriage, she would dominate her over sons and daughter-in-law. She doesn't share things with anyone. She was very much sarcastic, and she would like if people would get hurt by it. So she would make sure that she would pass a sarcasm that individual will get hurt by her behavior. Recently, she started having delusion there is someone coming from the corridor. She had a delusion that her servants has an eye on her. He is having She's looking at me. He's getting attracted towards me. He's having a bad eye on me. Respect is very important for her. She would always make some small problem as something very big. She was very particular about her things. In childhood, she had 3 brothers and 4 sisters. As she was the 6th sibling, studied till 7th, but the father expired, so she left studies. But she had a lot of interest in her studies. There was too much of poverty at that time. She came for a lot of hardship. The family did not have enough finances. She got married at around 27 years of age. After that, she came to Mumbai with husband. When husband would go to native place to look after her mother-in-law, she would manage the house and kids alone. So she was a strong lady. She's always been a strong person. She would quarrel with her sisters. Even now when she goes to her native place, and if all siblings sit and chat, she's very suspicious. What are they chatting? Whom are they chatting about? That everyone must be talking bad about me. So she feels that maybe that people are judgmental about me and talking something behind my back. So how will we analyze this case? That we want to treat her as a whole. So where does she stand if we saw the 3 approaches? So does she come in the first one, second one, the third one? The third one. So we want to find out something very strong, very syphilitic in her. But here again, what symptoms should we consider? What was her general disposition? So when we analyze such kind of case, first we try to understand what was her soric characteristic. What was her sora? What was her soric characteristic? Then how was she in the psychosis? So what was the kind of nature in sora? How was she in sora? She was a diligent lady. She wanted to learn more. She wanted to study more, but they came from a very poor background and she could not afford to get educated. And the father was not doing that well that he could afford education for them. So that was also that the knowledge was sacrificed. She's a lady who wanted knowledge, who wanted progress, but she could not get them. So that was the sora. But when she grew up, when she went into psychosis, what was her representation in psychosis? How? She was a very haughty or a dominating person, high esteem person, suspicious, highly suspicious person. Sorry? Yeah, to a level, yes. Fault finding, yeah, this is very important. There are certain traits in an individual which stand out. That means they are always, anything you do for them, they will find problems with you. You did not cook food properly, you did not do my work properly. Why are you making noise while eating? Why are you making noise while talking? So there are certain individuals who only find certain faults in you. So these are fault finding and quarrelsome constitution. So she would taunt somebody and she would not like people also coming inside the house. 1 or 2 days is okay, but then later let them go. And they purposely try to make bad food. So a quarrelsome disposition, a haughty and dominating disposition, a conscientious, rather a diligent disposition where she wanted to learn, but unfortunately she could not. So this is the information which we know. But what now and where now is she moving? What is the syphilitic in the mind which is coming up? There are certain delusions which are coming up. So which are the delusions which we can consider? So either someone has eye on me, number one. Somebody is looking at me, she's not looking with good eye. Or somebody is following me, or somebody is there in the room walking with me. Or some more other delusion. Or something else. Or we can still find something else. Now the important question is, should we really depend on her delusion? This would be a common symptom, right? Why? Because the mind is not under control. No, the slide, if you remember, when it goes to the tertiary, that the syphilitic, the mind is not under control. I need to catch hold of her body. We need to catch hold of her body. I cannot treat. This is what we were doing earlier. We were taking the delusions. We were taking these are pathognomic delusions. These are the disease delusions these are the miasmatic process which has gone to that level. Then body is throwing that delusions and illusions. So try to avoid that. So close the chapter of the mind. Close the chapter of the mind. Our diversion, our concentration should be on body. What is the body talking? How did she look? Emaciated. So some symptom, as Dr. Anima has mentioned, whatever is available in such diseases should be picked up, because that is eminent physically and visible physically. So what I could gauge is, yes, she was going on emaciating. So yes, many people will say, sir, but dementia mein bahut sare hote hai. Not all constitution do go by, because there are certain dementia patients also who are on the southern side, they don't go into emaciation. So this is a constitution which is gone into emaciation. So one strong general, what I said, strong general, which is a pivotal which we can enter through. See how we need to go and follow. We collected the information about her nature, basic nature. Keep it at side, which will be useful, because that is a disposition, mind you. That is a disposition, we will require it when we differentiate. So emaciation is the primary entry point. Then what else? What was certain symptoms which the body was attributing? Offensiveness, right? So offensiveness of urine, offensiveness of stool. So certain discharges which are offensive, and also I don't know if it is there in the history, but they were also very acrid. The daughter-in-law said that we could see the stain and the color being there on her clothes as well. So body was also showing certain symptoms of going into syphilis at the general level, at the perspiration level, at the discharges level. And here we need to have our attentions also. So they could be broad generals, or they could be broadly particular with a particular modality. But here I could get the broad symptoms that discharge is offensive, discharge is acrid, and emaciation. So when we combine these three, आगे जाओ, जाओ. Emaciation, discharge is offensive, discharge is acrid. So we have arsenic, ars iode, then we have Medorinum lachesis, nitric acid, sepia, sulfur and thuja. Now we use the disposition. Now we will use, so entry point physical syphilis or broad general syphilitic symptom, enter the case, now go down, her psychosis automatically, all will be covered. And what was the sensitive, what was it love, was it esteem remedy. So we require an esteem remedy, we require a remedy which goes into emaciation, and we require a remedy which goes into offensiveness as well. So, and we try to attribute, generally do not take the present thermals, because the present, again, body is not in his control. So present thermals would take us in the wrong direction. Have the previous thermals, it could not be importance to us. So we'll try to differentiate. Could she be a sulfur, sepia? So which is a remedy which goes into emaciation? Arsenic iode, even sulfur can go into emaciation, and nitric acid can also go into emaciation. So sulfur, she was not a sulfur, she was a person who wanted to learn more. Wanted to go ahead in life, wanted to learn more. But unfortunately because of this, she could not, the economical situation was not correct. So we want, sulfur is gone out, arsenic, iodine, nitric acid. She was not a person who would have a hatred. She was a quarrelsome individual. There's a difference between hatred and quarrel. And nitric acid can get very offensive and very hatred and very rebellious like mercury because it's an acid. So somewhere we have to differentiate between arsenic and arsenic iode. Chilly and thirstless. So arsenic or arsenic iode, which is the most quarrelsome remedy, which is fastidious? Arsenic. Arsenic iodes generally are not that quarrelsome. Arsenic iodes will come more like a lycopodium, very sober, very diligent, going their work conscientiously, diligently going on that. It's an arsenic which has that hida of, sarcasm. Arsenic has that hida of, going into that quarrelsome mode, fault-finding nature. A sense of lamenting also, yes. So, arsenic, 1 m we gave her, arsenic 1 m, and to my surprise, in a span of 1.5 to 2 months, that lady started to improve in such a beautiful manner, that she started getting the orientation first. The orientation getting back is primary, very important. Then she started getting control over her stools and urine, which is very important. Then she started getting control over her memory, and she started improving. See, what is important here is that even I did not know that can such bad looking, grony looking, pinning looking, and such a old looking lily can be arsenic. What we know about arsenic is very beautiful, like a phosphorus. Arsenic has wonderful features, good features. Arsenic is very meticulous. Arsenic is very hygiene oriented. Arsenic is high grade. Language is very, polished language. So this arsenic what we know about. But this is the psychotic arsenic which we know about. Every remedy passes through a different phase. Every remedy has sora, psychosis or syphilis. So what I want to bring the attention to is that there are certain remedies which we have a fixed image about, that they are like this only. It's not so. That if we understand the syphilitic aspect, and then I started wondering, yes, she could be a syphilitic arsenic. So when I'm trying to reverse her, when we are trying to reverse her, the disease situation should also reverse, but most importantly, she should come insecure, sorrow, psychotic kind of. Right? So we'll see that. वीडियो लगाओ उसका. एक उसका फोटो रहेगा तो देखो. एक मिनट. Can you see her? I'll show you the video also. इधर गया. Almost 1 month she came. Can we have the volume?
Unconscious condition मध्ये होती ती तर त्याची पडलेली आहे. विचारलेल्या प्रश्नाचे काही उत्तरही नाही दिलेलं नाही, आम्हीच देत होतो. आणि मला असं वाटत होतं की ह्या 2-3 दिवसात हे काय खरं नाही होतं. आणि जेव्हा आम्ही तुमचं औषध प्रथम घेतलं, काय दिलं आणि डोळे उघडले.
त्याची हालचाली कशी होते? मी पहिल्यांदा आलो होतो तेव्हा ते
काही नव्हते, ते काही कळतच नव्हतं. जिभेला रूच नव्हती.
She's a Marathi language. What he's saying is that when we first came to you, she did not understand anything. We thought that maybe 2 or 3 days she's going to go now. She's not going to survive anymore. But when we started with the medicine, just 2 or 3 days, she started improving in a particular manner. Gradually he improved, and then she came to our clinic. Now the funny part was the one which was standing behind, which her granddaughter, and she had taken admission in MBBS college. MBBS college. So this grandfather is also very censorious and critical. So he told her, I think you cancel that admission and take admission for homeopathy.
गोळीचा पोळा घातली तर ती खाऊ शकत नव्हती, अशी कंडिशन होती. आणि गोळ्या उघडत नव्हती आणि काय बोलत पण नव्हती.
त्यांचे त्रास काय काय होते मला तुमच्या
ते मग वाटतं ते आता काय त्यांनी डायग्नोसिस केलं होतं ते या डिमेन्शिया केलं होतं. त्या तिघांमध्ये ते डिमेन्शियामध्ये असे का प्रॉब्लेम होता,
काहीच नाही कळत,
लघवी कळत नव्हती, टॉयलेट कळत नव्हता. एकदा म्हणजे अनकॉन्शियस कंडिशन मध्येच होती. पण आम्हाला असं वाटत होतं की विदिन 2 days she will go. इतकं कंडिशन होतं, असं सगळे कपडे सोडून टाकायचे.
So he's giving the history that she's unconscious and blah blah blah. But then, of course, it's a video. But then we asked her that now do you cook food? She said yes, I cook food and I give it to my husband. And we asked her, do you remember cooking? How much ingredients to put in what? She said, I remember very well. I didn't forget that. She completely normal. She went back to her native place, and of course she went on Saclac. 1 dose of arsenic, 1 बूंद जिंदगी का. Easy, no? Very, very easy. Really, it is very easy. Do we go for one more case? You want to have a break? No. No? हाँ? हाँ. ओके. अभी ये खोलो. निसर्ग खोलो, निसर्ग. This is a case of very interesting case. Please excuse me, the Kerala doctors, you must have seen this case in SCPH, but slightly we'll try to elaborate on that case. नहीं ये नहीं उसका ये रहेगा हाँ निसर्ग का वीडियो रहेगा. हाँ फिर उसका वर्ड खोलो, योर मनी लिखा है ना.
इसके साथ भी उसकी नहीं पड़ती है. वो जो बोलेगा वही उसको भी वही करने का.
अच्छा, यानी वो जो ये बोलेगा
हाँ मेरे साथ. हाँ और कोई लड़का मैं उसके.
This was a case of a young boy around 12 years where he got diagnosed. Her mother went to an allopathic psychiatrist and got diagnosed as ODD. ODD means obsessive defiant disorder, what they call as. So they started giving different names. You know, we have obsessive compulsive disorder, obsessive defiant disorder, etc., etc., etc. But the presentation was, the boy did not listen to anything. The boy went into complete anger and disrespect for the entire family. The boy did not obey the mother, did not obey anyone, and he stopped talking with everyone. He didn't utter a word. Almost, this is a video of half an hour. He had come to my clinic. He did not utter a word. He was only looking down like this, and mother was giving his history again, telling him, please tell your history, please tell your history. He is not like an allopathic doctor who will give injection and leave you. You need to speak in front of him. So the mother was telling him, please go on, but he did not utter a word. There was not even an expression on his face. That was the amount of defiance. And no, it's only that mother wants me to come, I will go, I will just sit there and I will go to my house. The history was, I will just tell you the history in short. Her mother was a divorcee. And the father was diagnosed with schizophrenia. father has a history of schizophrenia, and the mother had a doubt that he should not walk on the same lines. And mother started seeing these certain changes happening to him in his nature, and then she realized, she approached us, and she brought him to us. So he was a very, what you say, playful boy, was a very kind of active boy. He would go to his school regularly, do his activity, do his homework regularly. They were staying, they were a nuclear family, 3 of them were staying together. The father and the mother had quarrels day in and day out. Every day he saw her mother quarreling the father. Initially it didn't matter to him because he was small, he was taking in his stride. But as he grew up, as I said, the Sora is such, his constitution was such that it didn't take an imprint earlier. But as he grew up, he came to the level of maturity and understanding, this symptom started to get imbibed in him. So he would stay awake at night certain times. He would want his mother coming next to him. Mommy, you sleep next to me. No, don't go to father's room. Every night you quarrel. So the mother told me that he would ask me every day to come and sleep in the room. But I could not manage every day because I had to sleep with my husband. So that also hurt him, that I care about my mother so much that mother is not listening to me or not following what I want. So the cheerfulness and the kind of openness which he had was gradually shifting, and he went into a mode where he had very few and limited friends. But then what happened was that anger started to pent up in him. The anger started to get accumulated in such a manner, because this is a psychotic way of he going into this problem, that he never vented out, he kept it to himself. And he would go to the school, so he removed the anger on the lower subordinate. He would remove the anger with his friends. He would remove the anger on the classmates, but not at home. So mother would say he would come home, just go inside the room, come home, keep the bag at home, go inside the room, close the door and sit inside, and not come out for hours. So he would listen to his music, he would listen to not talking to anyone. So that is the first time when a mother realized that something is not correct. But this went on happening regularly, went on increasing to such a manner that he started avoiding people from the family. He started avoiding people, he started disrespecting even the grandparents. So even if the grandfather called him, he would just say that I don't want to talk to you, please don't waste my time, hang up the phone, go inside the room and sit. See how Sora got converted into psychosis, and psychosis now was threatening to go into syphilis, or rather had already gone into syphilis. So he was also an artist. He used to draw a lot of sketches, nature. He was a lover of nature as well. He had good and close friends, and he was close to only one friend then when the entire episode started, but then he disconnected with everyone and he was aloof, and he sat aloof in the room. He refused to even speak about what was wrong, why he is behaving in such a manner. His academically excellence also started to go down. He was not a conscientious boy, but his performance in the school also started to get affected and went down. So mother was worried because he was going higher and higher schooling. Few years down the line he would go into 9th and 10th standard, and it was a cause of concern. Thermally he was hot, he was thirsty. But a mother would say that he's a person who would enjoy if my neighbors come to the place, if the neighbors are coming, and neighbors, because he would not take food in the house, and then I went and told my neighbor that you get some food from your house and give it, because he's not listening to us, anybody. So the neighbor would come and get the food. He was close with the neighbor. There was an auntie who was staying there. He was close with her, and she would get the food and he would eat the food from her house, but not in his own house. So this was a broad history, a broad nature, how it developed, how we went from SORA, psychosis, to syphilis. But what peculiar thing was, the mother used to say, then nowadays what I realize is at evenings or at late evenings at night, he starts getting very restless. He starts moving. He starts moving. He starts thinking. And he refuses to talk to anyone. So I asked, what is the time generally? Sir, there is not fixed time, but generally after the sunset, he gets restless. He gets very highly, emotionally charged, and he is in his own world, thinking something, and just walks around. So this is the only symptom which my mother gave me. But tell me one thing, that does he come out for food? Yes, only for food he will come out. Rest, everything is in his bedroom. He doesn't come out for anything. We call him for discussion, call him for food, we call him for breakfast, call him for tea, nothing. Everything inside, only for food he will come out. And food only from her aunt. So this is also a trade. When a particular remedy goes into a syphilitic or a psychosyphilitic sphere, they get on to one-on-one attachment. Wandering. But he was not going out somewhere. He was more moving there. In wandering, it would be rather going to different places there. So I was also wondering that, what is it? What was it? Why he should do certain thing like that? What could be the reason? Why does he get so restless? Why is that he get that restless? And then I asked her mother, tell me one thing, how does he eat food? Sir, he will eat it very fast. When you give him the food, he doesn't look here and there, and he will just tuck, he will start putting in the mouth. He's very quick on his meals. Within minutes, the food is inside and is out. So then, after he eats the food, he goes and walks again. No, sir. Generally, I have not seen that. So if it's a late evening, I ask them, okay, what time do you have your dinner? Sir, in our house, we have dinner early. We have at 7:30. I said, 7:30, that's early. Because Bombay, generally people have food at 12 o'clock. Syphilitic time. But that's not a right habit, but 7:30 is a good time, perfect time. And I said, then is it that whenever there is a time of your food, he starts getting restless? Sir, I have not observed that way, but yeah, I will see and check and let you know. So it did that. It was whenever he had hungry, he used to get restless. So one thing for sure, I got a strong general that this is a remedy which is hunger aggravation. There was a rate of hunger. See, a patient will not come and tell you, in such cases, he is not speaking only. So, he will not come and tell you, sir, I am hungry, give me food. No, we have to decipher, it's kind of go into and understand that why. So, there is certain pattern where he gets hungry, he gets aggravated, he gets restless, he starts moving. When you start moving, means what? When you start moving, that means there is a definite set of certain anxiety which comes in. There's a certain set of anxiety which comes in, and that anxiety has to be, expressed or calmed down when he has to walk around. So then I was trying to decipher more. I said, one, that I want a remedy with hunger aggravation. What else? Anxious, yes. But now, as I said, certain sorosyphilitic I require for him. The first part of the slide. If I get certain sorosyphilitic and a strong syphilitic general or an aggravating factor of that constitution I have. So if I have combined these two rubrics, our remedy will come out. Then we'll confirm the SORA. Yeah, he was hasty also, very quick in food, very fast with food. No? So, generally we know which are the remedies which eat very quickly, which eat very fast, which are very hurried. But we normally try to avoid entering through that manner, try to understand it more in a deeper manner, pick up a pivotal rubrics, enter the case, and then to decipher or differentiate, we can use that hurriedness. We can use that amount of appetite where he goes into eating fast. Thermally he was hot. So hunger, aggravation, anxiety. But now, as I said, general anxiety is a general miasmatic trait. So if you want to get anxiety which is a sorosyphilitic anxiety, there has to be an aggravating or ameliorating factor. Aggravating and ameliorating factor, then it becomes exaggerated. For example, even nausea for that matter. Right? Nausea, getting up after, sleep after. Nausea, eating after. Nausea, night during. So there are particular modality which starts getting attached to it, then it becomes amplified. Amplification. Sorosyphilitic it can become. So which is that constitution and how does that anxiety gets elevated, and how the anxiety gets elevated by hunger, but that anxiety gets ameliorated after eating. Are you with me? Right? So we want a remedy which that anxiety, restlessness gets better after eating. That's an sorosyphilitic symptom, and one is definitely grand general of hunger aggravation. So when we combine these two, अभी उसका इस पे जाओ, रेपर्टल एनालिसिस रहेगा, देखो नीचे हाँ नहीं नीचे हाँ anxiety, eating, amelioration, hunger, aggravation. So we have sulfur, iode, graphites, aurum and anacardium. Anacardium also, all symptoms are better after eating. Mentally restless remedy, very, very blasphemy, rageful remedy. Anacardium is cursing desire too. That he will have a bad mouth. ये तो मुंह नहीं खोलता. He doesn't open his mouth. It is much more higher grade than even the other remedies. So anacardium ruled out. Aurum is a conscientious. Graphite is a carbon. Slow, sluggish, money-minded, nothing of that sort. So either he is a iodum or he is a sulfur. Now, retrospectively disposition we will try to understand. Hurried eating, fast eating, artist, also a cheerful disposition. See, that is why it is very important for us to take the history or the nature, previous nature and the change nature. So whether the constitution has gone from introverted to extroverted or extroverted to introverted, because then we can join the dots somewhere. So which is that constitution? And sulfur, when it goes to the syphilitic sphere, it will have connection like a natrum one on one. So generally what we think about sulfur is very extroverted, blah 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 blah, coming and giving information, talking big and boasting everything. But quiet, then we think about natrum, we think about magnesium, we think about the introverted remedies. But when we go the other way around, try to pick up the syphilitic pivotal, and then we know that this is a very psychosyphilitic sulfur. So certain psychosyphilitic sulfurs will be introverted. You will not have blah 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 blah. But it was the psychosis is so much As I said, the yellow part is so much that we do not read behind the maze. And that we need to go penetrate behind the maze and find out that lurking syphilis which is there, which will take him to the syphilitic sulfur. But we want to get him back. We want to get him back, get him reversal back. The clock has to come back to more psychotic sulfur as well. So we gave him sulfur 1M. Mind you, sulfur children, again, soric sulfur will be anticipatory. Soric sulfur will be lean and thin. Syphilitic sulfur will be lean and thin. Psychotic sulfur will be hefty, stoop shoulders. Syphilitic sulfurs also would be stoop shoulder. But psychotic shoulder, this will be hefty. Psychotic sulfurs again well dressed, well mannered. But when you open the banyan and open the clothes, the banyan will be torn inside. So we gave him sulfur 1M, and we'll see the follow-up now. This boy went on improving. I just prescribed, and the behavior went on improving in such a manner. The mother would come and take the Saclac from the clinic outside. So once he had come with that auntie, then I asked that, come inside, tell me how is he, almost 1.5 years or so, or even more. How is inside? Tell me how is his nature? Yeah, he improved very well. His nature changed a lot. His anger calmed down a lot. He goes to school. His performance in the school improved a lot. I said, then who will come and tell me? You should come and at least inform us, no? Yeah, we thought why to disturb. But this is very important, that keeping a regular follow-up. So because I had to take the video, no? I had a psychotic motive behind, but I had to take the video, please come. And then I told her, next time please send her mother. But the mother also did not come after. Of course, he went on improving. 2-3 years down the line she came. She used to come and take medicine for cold. Cold. Because all his nature improved. The entire defiant nature improved. He improved with his studies. I'll show you the video. He grew up. And then he's told the mother, let's go to the doctor and fight. I said, why? No, because I'm taking medicine for cold and it is not going for 3 months. So he came to my clinic just to fight with me that, sir, you are treating me for the cold last 3 to 4 months and my cold is not going. I said, good, at least you came to fight. I could take your video there. Sora, inflammation coming back, let the discharge flow. Nothing matter. But see how the psychotic sulfur, soro-psychotic sulfur also, he was the lean and thin, but lean and thin with long neck. Lean and thin with long neck. That's uska video lagao na. Translated. एक मिनट.
फ्रेंड्स के साथ भी उसकी नहीं पड़ती है. वो जो बोलेगा वही उसको भी वही करने का.
अच्छा, यानी वो जो ये बोलेगा,
हाँ, मेरे साथ, हाँ. और कोई लड़का, मैं उसके फ्रेंड्स को कुछ ऐसे बात करती हूँ कि ये निसर्ग ने क्या किया. वो कहता है, देख मेरा फ्रेंड्स है कि नहीं, मम्मी को बोलना मत. बोलेगा ना तो जा, आज से तो मेरा फ्रेंड है. तो उसके साथ बोलता ही नहीं है. 15-20 दिन तक बोलेगा ही नहीं, बात ही नहीं करेगा. ऐसा नहीं है. और मेरी अभी पापा को तबीयत अच्छा नहीं था, तो मेरी बड़ी सिस्टर को भी बुलाया है. तो वो आई है, तो उसने कुछ ऐसा बोला कि नहीं सब तो पढ़ो, मम्मी का थोड़ा ध्यान रखो, मम्मी को इतना पेन हो रहा है, मम्मी चिल्लाती है, तो उसका भी थोड़ा तबीयत का देखना चाहिए. तो बस चुप बैठो तुम, बोलो मत, ऐसे ही बात करो.
You talk like that. Just shut up. Don't talk with me. So those insolent and inappropriate behavior with the adults. The mother is a Kali.
एकदम रूटली बात करता है बड़े से, एकदम रूटली. मैं भी बोलेंगे जाओ, आपको जो करना है करो. हाँ जाओ, भेजना है ना, भेज दो. ऐसे फटाक से जॉब दे देते हैं. कोई भी रहेगा, मेरी सिस्टर रहेगी, मैं रहेगी, नहीं तो बात नहीं करेगा, ऐसे ही होगा.
तो फिर जाके सब
नहीं ऐसा कुछ उसको बुलाते हैं. हाँ, तो बोलो पापा का कुछ दवाई करो, नहीं तो मुझे अटैक आ जाए. क्योंकि दोनों का टेंशन, मैं और मिला सब जगह।
किधर गया उसका और एक था वो? हाँ
फ्रेंड्स के साथ भी उसकी नींद पड़ती है और
ठीक है।
फ्रेंड्स के साथ भी उसकी नींद पड़ती है। वो जो
This was the mid follow when he came with the auntie, and now we came with the mother in 2011.
अभी क्या क्या चेंजेस हुए मेरे को बताओ उसमें,
उसका नेचर चेंज हो गया।
क्या चेंज हो गए?
हाँ, एकदम शांत हो गया।
हाँ
अभी जो
और
पहले
फिर?
नहीं सुनता था, अभी वो सब सुनता है।
एक थोड़ा बच्चे का, कैन यू सी द स्माइल एंड द नेक टिपिकल ऑफ
अभी
सल्फर,
जो-
एंड देन was those people who sit like this, lot of ego, huh? Or not ego, rather they want their presence felt. If you see the body language, read the body language, they want their presence felt. So they will sit like that, talk like that. Normally the business tycoon people in the corporate world, when they come and they talk like this, they sit like this, or they talk like this. You, somebody here doing it, you can see next. But this is very typical. This is the psychotic element which came back. So he wanted to live, he wanted to survive. So man is a social animal. Man has to, have dialogue with all the surroundings, all the people. So all these are all psychotic things, and hence we should know what is psychosis. Ahead, आगे जाओ.
पहले नहीं सुनता था, अभी वो सब सुनता है।
क्या क्या सुनते हैं?
सब सुनता है। हाँ, तो वो पहले ऐसे शर्मा के नीचे ही बैठता था, हमेशा किसी के सामने नजर से नजर बात नहीं करता था। फिर धीरे धीरे डॉक्टर की दवाई जैसे जैसे उसके ऊपर इफेक्ट होती गई, वैसे वो फ्लुएंटली डॉक्टर के सामने नहीं, सबके साथ बात करता है। ग्रुप बनाया नया।
पहले कैसा था?
पहले वो बहुत मस्ती को, जब भी छोटा था तभी सबको
I'll show
देता
you
था।
how he talks also. See this? You saw that?
अंडरस्टैंडिंग क्या? अंडरस्टैंडिंग
अभी उसका अंडरस्टैंडिंग बढ़ गया है, जो पहले नहीं था।
अच्छा
कि पहले पापा थे तभी भी वो पापा को भी परेशान करता था। पापा जो बोलते थे कि नहीं ऐसा कार्टून नहीं देखना है।
Stay in AC for long time. If I do, I have to catch a cold.
okay. But now also you have cold.
Yes, I do have. I'm suffering from cold from 3 months.
I am suffering from cold from 3 months. This talk is also sulfur. Somebody who talks like the psychotic sulfur, his body is like, but the talk is in this manner. So he became independent. He went to South Africa alone for a trip, and he sent me a photograph from there. That sir, I went. I will show you that photograph as well. Then
And sneezing, you said sneezing or coughing.
and he became tall as a giraffe. And the best part is he stayed cured completely. He went to United States and he got scholarship in engineering university. And almost 1 year back, the mother is a Kali, no? So she sent me the photograph also. Let's see how my son looks. So I'll show you that photograph also, how handsome he became. Typical sulfur. Lean, thin, tall neck, and hair is all around the bush. Sulfur 1 mg single dose. Easy? Very, very easy, no? Mine is really very easy. That is why I showed you the 3 slides. If we understand where are we, what are we treating, finding of the syphilis, connecting the cord, finding the sensitivity, finding the SORA, psychosis gets connected, and the remedy is out. One more case, right? कितना टाइम है अभी? और है ना? हाँ. ये लगाओ.
You are requested to sit down. Let's continue our session.
सलमा खातून लगाओ. Very interesting case. Very, very interesting case. This lady came with hysterical behavior, maniacal behavior, and the lady was, when she came first time to us, she was very, very scary lady, very, very scary. I still get goosebumps on my body because she was very scary looking. The eyes was popping out. And you know, certain times when certain people come and meet you, you come to know that the vibrations are not good enough. So the history was, she was diagnosed as panic attacks as well as hysterical attacks, and she would go into very, very severe hysterical mode. Hysterical means she would feel that somebody is throwing her up, somebody is throwing her down, somebody is throwing her on the wall, and she used to spin around, fall down, and what not, bad hysteria, complete bad hysteria. One more thing, what I came to know later on was she was a tantric lady. You know tantric? Black magic lady, and she had inculcated certain powers in her in order to, so that she could see the future of people and she could tell the people. And later on came to know from her husband that she had some, not godly, but that spiritual spirit in her, where she would go into that mode. I don't know if they have here, normally those, and they have that, they feel that the goddess is entering and the spirit has entered, this and that and that. So I got scared. A lot of goosebumps then as well. The history was, the lady was, she got married at a very early age. At the age of her, she was just 15 or 16. Then when she was in her parents' house, her father was very strict, very disciplined. She had one sister with her. She was the younger one. They were not allowed to go out, meet boys, meet friends, go out for even normal picnics. So you are under a strong vigilance, observation. The father would be very strict. The father would come at 7 o'clock. They would want the girl also to be at home at that time. So her childhood was very, not protected but overprotected, and a lot of fears in her childhood. As she married, her husband was very frivolous. And she said that husband did not give me good time enough, and hence I had to look after my children and my family as well. He supported, but financially we were not good enough. So I had to find out a way to earn financially, and I had to find out a way to sustain my family and my family's future. And hence she said that I learned certain vidyas, I learned certain techniques from people to how to increase the power and how to read nature, or how to see the future of individual. There used to be a lot of rush in her house. The husband said that, sir, she doesn't look like, but she is what you say. There are a lot of people who just come to meet her, come to see her and try to understand nature. And there are a lot of politicians and builders also. People do not know, who come to her to have certain black magic on certain people as well. So I said, maybe she must be having some powers. Very interestingly, that such spiritual people always fear from predictive homeopaths. Because they have a lot of fear, and I'll come to that how and why. But she was very skeptical in coming here as well. She did not want to take any treatment. But when she came also, she came like this. Like this. And we wanted to video her. She didn't allow us to take video. She said, if you keep the video on, I'm going out. I don't want the video to be on. Shut off the video or else I'm going out. I said, fine, fair enough. We don't mind. Here's the history. So she started giving her history, started telling about her childhood, started telling that what powers I have. Doctor, I can see certain future. Doctor, I can see spirits. I can talk to spirits. I live around with spirits. God is God and Goddess is coming and going inside the room. I can see the death of certain individual. But I said, does it happen? I don't know. I never go and ask that individual. But I can see certain things which could happen, and certain negative vibrations or negative things only start affecting me very rapidly. I said, fair enough. What else? What can you tell me? She said, when I sleep at night also, I cannot sleep. My sleep is very restless. I have to get up. Because once I try to sleep, I feel that somebody is killing me. I feel somebody is constricting me. I feel somebody is sitting on my chest and want to, kill me in bed. I said, then what will I treat you? How will I treat you? Tell me something about yourself. Tell me something about your nature. This is what I am, sir. This is what I am. Please give medicine. If you can give. Otherwise it is okay. I will take care of myself. This was her words, what she told me. I have good power enough that I will take care of myself. How will you decipher in this? Which part she is into? And the husband says that almost every day she goes into and then she will tell, your future is very bad, your husband is going to die, and all those things start happening. I have never done it, I am just showing you. But when they do it, it is very, very harsh. This is very kind of a hysterical reactions. Very importantly again, what we were talking, that how, when, where, how it has gone up the layer, what is the representation, what was the seed, what is the fruit which is she's bearing it now. So I said something is amiss. I can't prescribe on this. There is a lot of problem. So I tried to take history from her husband. I said, husband will get. Husband said, yeah sir, otherwise she's a good lady. She works in her house, but she's very money minded. She's very money minded. She will make sure if somebody doesn't pay her, she will make sure she will get behind that man. And then she has her own technique of keeping that man in her kabu. They have something, something tied. I said, forget it, but any specific nature you would, no sir, I would say she's a good lady. She's a normal lady, she's into spirituality, she's into this kind of ghost and spirits and seeing of future. I said, but normally does she get any fainting episodes? I asked him. Sir, not really, she doesn't get fainting episodes, but she goes into a phase where it is very difficult to get her out of that phase. That zone she goes into. Her voice becomes very loud. Her eyes becomes red, and she starts talking in that tone as if some spirit has engulfed in her, and she goes into that zone for a very long time, and it takes a lot of time to come back to her normal and natural zone. I said, is that the syphilitic thing which we are looking at? No, it could be the disease reaction also. But yes, she said she can predict the future very correctly. She can, very accurate. They call it, like, I don't know what they call it here, but in Hindi they call Kali Zaban. What she will say has to happen, and generally people face that future as well. So So I toiled a lot, tried to understand. Tell me history, tell me the history, tell me history. Because again, the world is psychosis. She was into already syphilis. High grade syphilis. She was giving me a lot of psychosis and history of syphilis of her nature, of her profession, but not her nature. But not her nature. I said, tell me something about her fears. Does she fear anything? Sir, not really. She doesn't fear anybody. She sits in the dark. She can go to the this thing, what do you say, the cemetery at night. She can do her activities there. Whatever she does, she can do. And she doesn't believe in any specific this thing, religion. She believes in Mohammedan, she believes in Hinduism, she believes in everything. She believes, and she takes all the powers related from all the religions possible. I said, okay. How to proceed? I also got lost. Some symptoms you give me, because everything you're asking, they're repeating the same thing. Because these individuals will never open out. They will never ever open out. It is again that psychosis has to be penetrated, has to understand how and why and where is she landing up into a problem. So I just asked her, tell me something, that how does it, when she's sleeping, what happens? So she feels suffocated and she gets up. So I said, why? It's only when she's sleeping she feels suffocated? Yes, sir. Generally she doesn't sleep in the afternoon, but at night there's a specific time when she's sleeping, she gets into that zone of suffocation and she lands up into a problem. So I asked her, what happens? I said, somebody's pressing my throat. Is it, you feel somebody is pressing your throat? She feels, I feel difficult oxygenation. I cannot sleep, I cannot breathe in, and I feel difficult oxygenation, and I get up. I said, okay, I kept that thing as a side. I said, I'll probe and evaluate that later. So I asked the husband, tell me one thing now, that any specific nature you remember when you got married? When you got married? Because I wanted any peculiar trait in her, some peculiar trait, that what was keeping her going in that fashion. So he said, you know what, she did not like anybody photographing her. I said, now you talk something. Now you talk something. And then it realized, oh, when she came, she did not like the camera also. See, certain times we see it, we observe it, but we do not take into consideration and probe it. But then when we go back, we get the similar history, we come to the know, yeah, this was also the trait which I missed. I missed somewhere. So why does not anyone like photography? Here I think everybody likes, no? Selfie. Everybody likes photography. I don't know, there must be some individual who don't like. That's individual opinion. Loss of self-esteem could be, yes. So one faction is that. Sorry? Feel inferior, that's what, loss of self-esteem, as they mentioned. Or she wants to hide, right? But then why she wants to hide? Sorry? Fear of losing power could be. Embarrassment, not as such, because she was quite open about telling her things. She was not good. She was very, I will show you the picture as well, the video as well. She was very dangerous looking, and she was full black. Completely black, eyes popping out with all the gold ornaments. I probed on that. I said, tell me something. Photography. Yes, she had a fear. And then I went back into the history and where she had mentioned that she was scared of her father. She was terrified with her father. So she was a fearful lady. She was a fearful lady, a lady which was kept under vigilance, strong vigilance and nomination, where she developed that fear about her father, and that fear continued to build up, that she did not want to get close to her father, or the father should not see her somewhere. I said then, okay, somewhere I'm coming closer, understanding her somewhere closer. That fear factor, that hide wala thing and photography, some dots are getting matched. Fear of being exposed, yes, one. Could we think about that? Yes. Fear of being exposed, yeah, one thing we can take that. So, as I said, that we need to have something still very deeper and higher. Because fear, yes, fear, we are getting closer to it. Yeah, she said fear of getting caught as well, fear of getting exposed as well. But that fear developed from the childhood, and she wanted to hide. And hence she did not like to be photographed. And very interestingly, then we realized that she would come inside our cabin and always see any camera is on or no. See how we later realized that, oh, some camera is on or not camera is on. Very, very sharp lady. Very sharp lady. And when, as I said, there is a problem with her perception. There has to be the perception which went wrong with her sora, and that for that psychotic symptom got reflected into syphilis. And बाद में उसका husband मुंह खोलता है. बाद में he opened out saying that, because we probed, tell me what is the fear, tell me what is the fear, tell me what is the fear. And then he said, yes sir, she has a very, very different way of walking. I said, how? When she walks, so we are coming to delusion now. You get me right? Right? So there is a definite false perception in the childhood. That fear factor got converted into a false perception. That false perception took her into this mode of energies, spirits and ghosts. As I was telling you, it is a build-up. So there are a lot of individuals who have this trait. And we do not, close our minds on that. That they walk in this manner. We have a driver also in Mumbai who does that. So we are very careful when we are talking, because he's. What is this? When somebody suspicious? Yeah, but we are getting closer. What is a delusion? Somebody is watching me. Delusion spied upon. Somebody is spying me. So when somebody is spying, they will always have the action of either turning behind and watching if somebody is spying me, or in front it will be cameras. At front it will be the photograph. So That was the delusion which we got in her. As I said, no, go throughout the trauma, syphilis, gestures and acts were accordingly. So when we take delusion spied upon, we have Blackassis medorinum, and one more remedy is there. नीचे है क्या उसका देखो. See, एक मिनट. See, this is how we try to see also that Sora, she was timid, introverted, non-conscientious, angry, and fearful. And many a time, this is the fear which gets converted. This is the fear which gets converted into a delusion. The fear which gets suppressed, the fears which is not able to express, gone into a false perception mode. But then, now from introverted, she went to extroverted. The earlier boy, from extroverted to introverted. So it was very, very important that she changed there when she went into psychosis. And also respect and attention, very important. Respect and attention is also very important, because why? People should come and people should know what will happen. Dependent, secretive, fear of disease. Yes, I forgot to tell you, she had a lot of fear about her disease, which she grew up also with. So syphilitic was supernatural powers and clairvoyance. But here the clairvoyance has to do with her syphilitic process attribute, not her nature, not her basic disposition. The inherent, what was her nature was not that. Now, very interesting thing is, after we give the remedy, should her power be there or no? So the Wi-Fi should get switched off? Or they should have jammers? How they have in this hall? Yes, it does happen that we are the only people, or we can call ourselves homeopathy Sattvic Tantric. I will share with you an incident which happened recently with me in my clinic. There was one man who came to us for treatment of constriction in the throat. And he was giving history to the assistants, and initial first half an hour he did not open out anything. He was just giving about his nature and everything. But after some times he said to the assistant that I have supernatural powers. And that poor girl she was taking the history, she got frightened. And when she got frightened, she said, I entered her body, I went inside your clinic, I went to the pharmacy room, and I saw your medicines and came back again. I said, okay. And then this was when he came inside my cabin. And what happened was, when he just came inside, I had gone to the washroom. So he went back. He went back again. He allowed me to come inside, and then he came back. I said, why? He said, no. I have to see the doctor first to keep the control of doctor. If the doctor sees me first, then I don't have control. That is my power. I said, fair enough. Then what? Then he said, I entered through that lady, went into your clinic and saw your pharmacy. I will only take medicine if you promise me that I will not lose my power. Only if I was shocked. I did not knew that person. We had never told them about what we are doing and what is homeopathy. And he's telling me on the face that if I lose my power because of your medicine, I'm never going to take it. This is the power of homeopathy that is spiritual people are afraid of. So we are better tantrics. We are more high grade tantrics. The power is in our hand, how to use it for good or bad, don't it for bad. But he got afraid, and then he is, I promised him and I told him that don't worry, you will not lose your power. And I prescribed him certain drug. And next time when he comes and he told me, doctor, you had promised me you will not touch my power. You know what? almost 50% of my powers are gone. And nobody is coming to me. Everything is getting wrong. I cannot predict. So please give me something to increase my frequency. I said, sorry, that doesn't happen. It is for your benefit. Our science has that amount of, that is the level of what you say dark energy or the positron world that these people cannot enter. They cannot do any wrong things. They cannot play with energies. It was a very, very scary case. It was a case of, again, constriction of a throat muscles, where he said, I can literally take energy from people, but mind you, sir, I take negative energy, and 2 days I literally turn bluish black. And I saw that. His hand turned bluish black completely. I cannot sit for any puja. I did not sit for my own wedding. I did not sit for my own wedding, sir, that I drained a lot of energy. I cannot see. Bluish, blackish, full blackish, and a very wild eyes. And his daughter was even dangerous. Because later on he brought his family, his wife and daughter also. But we gave him Vipera. He was Vipera, very fast, very agile snake, black energy, highly destructive, very fast, calculating, and improved very well. So these are generally Ophidias which are playing with high grade vibrations. They can feel the vibrations, they can take the vibrations, but it is not good, not natural. This is not Sora. This is not Sora. We are not supposed to see what is outside or apart from reality. And it has to happen that this has to go. And this lady also, I told her that, please forgive me, I am sorry, but you do something better for your stomach, but not this thing, because it will put you into problems. But it generally, when you tell them, they don't take it, because they are doing it for so many years. But you give the remedy, they automatically do it. Because you are running them from syphilis to psychosis, automatically they come towards a good, they come towards the better part, and the loss of power, they cannot see anything, they leave it automatically. So it happened that this lady completely left. She left completely in span of even 1.5 or 2 months. She left completely, and she started helping in the husband company for her living. Completely gone. She did not get those vibration, ghost and this and that, and she went the right way of earning. Remember, psychosis also has to come through good way. The psychosis which comes through bad way will always go through bad way. So she was earning money through syphilis, psychosyphilis or syphilis. Money will never remain in your house. Money will always go. Money will never stay, because that's the not right way of earning money. So, or whenever these people take money for this Vidya also is not 100%. The real Vidyas or real Sattvic Vidyas, what they have, they cannot charge money. And there was a lot of psychosyphilis in this lady. So we go down, she was hot, thirsty, left-sided. So she was Aquamarina, Lachesis or Medorhinum. Very easy. She was Lachesis. So I had to differentiate between Medorhinum. What is that? Differentiate between Lachesis and Medorhinum. How do we differentiate? How do we differentiate Lachesis and Medorhinum? Both are introverted, both are timid, both are manipulative, both are suspicious, both go into a negative mode. But of course, even Medorhinum is an esteem, a love and esteem remedy. Lachesis also is a love and esteem, but esteem is more. But Lachesis snake will go for these extrasensory perceptions. Medorhinum will go into imaginations. Medorhinum goes into creativity. Medorhinum goes into fantasies. Medorhinum will go into more delirious state. deliriums, but extrasensory perceptions, spiritual powers, going beyond the normal realms, it is an ophidia which has to correct. And then retrospectively going back, understanding the Sora also is introverted, fearful girl, which delusion went into a delusion or a false perception of being watched. And very importantly, night aggravation of the throat and throat muscle, constriction of the throat muscle, suffocation of the throat muscle is also lachesis. So anybody coming with you with suffocation, and I get up because I feel constricted, affection of the throat muscle or constriction of the throat muscles, going right to breathless and kind of suffocation, think about lachesis. So we gave her lachesis. Upar jao. And we'll see her video. पहला ये लगाओ ये
सुनिए ना, ऐसा ऊपर फेंकता था आसमान में और ऊपर से नीचे लाता था और इतना चिल्लाते थे जैसे मौत नहीं होती है, उतना चिल्लाते थे। तो घर का आदमी ना, कभी आदमी रहा तो धर के ले गया, कभी बेटा धर के लेके जा, थामे चक्कर आता था तो बैठ जाते थे। बहुत तकलीफ थी डॉक्टर से।
क्या हो गया पहले, अब क्या नहीं?
She was very dark, full black, and her eyes used to pop out, and her voice was very loud. So this is also one of the entry point in psychosyphilitic lachesis. They are very loud and very expressive as well.
कर सकते थे और या अभी आप क्या कर सकते हो?
पहले कुछ भी नहीं काम करते थे, बैठ नहीं पाते थे, कपड़ा नहीं धो पाते थे, खाना नहीं बनाते थे, चल नहीं पाते थे, अब सब चीज करती हूँ।
थोड़ा वजन भी नहीं उठा पाते थे।
This is also there that when they go into this hysteria or hysterical phase, they get a lot of energy which is drained out. And they cannot walk, they cannot get up, they cannot do things, they cannot cook food, they cannot lift up things. That's the amount of energy which is lost.
वजन भी नहीं उठाते थे। अभी तो बड़ी बड़ी डेक्ची खाने उने की बनाती हूँ। बच्चे
अकेले?
हाँ, मतलब सब थोड़ा बहुत साथ देते हैं। काम कर लेती हूँ, अभी 2 घंटा 1 घंटा चल लेती हूँ। सब चालू हुआ है, अभी पूरे में खुजली है। देखिए ना डॉक्टर साहब, ये सब ऐसा ना कुछ।
Now she is that the experience also syphilitic. That also when a disease is getting reversed, you expect certain lower inflammatory disease coming, no? Respiratory tract, GI tract, urinary tract, or lot of itching on the skin. So itching started on the scalp, then itching started on the shoulders and the face, and then itching started to go down, above, downwards.
नहीं है मगर खजवाता है ये। अच्छा। यहीं पर से इतना दूर से पूरा बदन खजवाता है। पहले से बहुत बेहतर, बहुत बेहतर।
And I'll show you the last video. Almost 6-8 months later. किधर गया? और एक ट्रांसलेट किया था।
तो हमारे चल फिर नहीं हो रहा था, तो दवाई खा के।
Can you see a change in her? Now she's come back to the psychotic lachesis. Psychotic lachesis, round face. The black discoloration has gone. She's getting more normal melanin secretion. And then, of course, then all the foppishness started to come. She's wearing gold here. All when it starts coming back, the psychosis starts coming back, all the jewelry and the makeup start coming up. And mind you, even the lurking hysteria which was there went down. If you see her, listen to her, she's calmed down when she's talking. that ये होता था, वो होता था, ऐसे होता था, तभी ये होता था, ये होता था, ये होता था. That is the amount of hysteria which is lurking there. Because these are also symptoms for us. No? These are also important symptoms. Each and every symptom which the body is giving, which is important to us. And also to understand how the reversal is occurring, how the miasm is shifting, how we are trying to reverse her. She came back, her itching went down, she started getting some cold coryza also. She started getting itching on the skin also, but she didn't go into that hysterical mode. And she subdued down. So the lurking, what we say, the lurking hysteria which is there, as I was talking this morning, was the lurking hysteria which is there. If you allow to remain it there, she will go back again to that hysterical state. So it is very important for us to see a definite shift in the miasm. A definite change in the miasm, a definite change in because mind and body will speak the same language. Your nature will attribute your features. So the features also start changing. She went into more psychosis. She had started losing weight. She started going down, black, lean, and haggard looking kind of lycosis, psychosyphilitic lycosis. She's come back to the psychotic lycosis. Easy? Was this easy or no? So we should break or one more case? We have time? Yeah, you can see the video. Yeah.
कोई ऐसी बॉम्बे के जगह छोड़े नहीं, उसके अलावे बताया गया कि जा.
She's just telling that I did not leave a single place in Bombay. I went, you know how lycosis locality is? You know, all the original lycosis locality came back, that I did not leave a single place in Bombay. I went to all doctors in Bombay and nobody could diagnose me. Nobody could treat me. They gave me just anti-psychiatric treatment to dope me, but nothing happened. And I came here, I got treated in 6-8 months. I'm completely fine. I'm doing my regular job and activity normally. But now she is only coming for cold and cough, cold and coryza, inflammatory complaints.
तो फिर यहाँ
बंद करना. We'll go for one more case. Yeah, this is important. I'm sorry, I forgot that. Right remedy, these people will allow photography. In the first follow-up itself, she allowed me. And this is also very important. Certain people who do not obey or understand the importance of what we are doing, and you give the minimum, they start understanding. For that matter, not even photography, certain, the Rudraksh, what they wear, or they wear the Taweej, or the, stones, precious stones. And we tell the individual, I think for you can avoid that. Don't wear it for a particular time. And then, no, nothing of that sort can happen. But don't speak to them. Write simillimum, and next time you will see it will be gone. Huh? Next, please. Chennai. Yeah. So please excuse me, certain SCPH doctors, that I have to present this case as well. This is not a psychological case, but this is more to do with the pathology. Right? So this also is a very interesting case of a young boy who unfortunately in his mid-20s started to go into scoliotic condition, and he started drooping down to a level where he completely went into a bend. Bend where he was unable to sit, he was unable to talk, he was unable to even do his regular activity. So when he came to the clinic also, he was highly restless, he could not sit. His parents or her mother gave the history. He had no father, of course. So the mother gave the major history and he was contributing in between. The history was that this boy in his mid-20s, when they were staying as a family, the father was extremely bad with the mother. And the mother and father used to quarrel a lot. And the father used to hit the mother in front of the child. The father he was an alcoholic, used to come, hit the mother badly. And this thing earlier, it didn't matter to this boy, but as and when things went bad, he started losing his sleep. He started losing his sleep. He started imagining, he started thinking about his mother, that is my mother all right? And for that he used to stay awake at night thinking that everything is right with my mother. But this had a reverse reaction on him, because the mother also got wild on him. The mother also got angry on him, and mother would also come and spank him badly. So both ways he had problems with seeing the relationship between husband and wife, his father and mother. At the same time, he had problem with the mother also banging him and smashing him. And nowhere else he could vent out his problem, and he had to suffer. Mother was very, very, very strict with him. So he was a very, a cheerful child, a playful child. He used to like going to places. He used to like seeing beautiful, sceneries. He used to like going. He had the desire to wander. He wanted to wander to certain different places. And this desire was not fulfilled. This desire was not taken care of. And then gradually he went further into more deterioration at the mental level as well. For his diagnosis, they diagnosed as query scoliosis, query dystonia. They were not able to come to a conclusion, but was there definite pattern of scoliosis which was seen. He was hot, he was thirsty. He was a very sensitive and emotional child. So when he came also to the clinic, he was highly emotional about her mother, because he wanted to get well soon so that he could see her mother smiling, because mother would see his condition and even start weeping. So his trauma was that his biological need was love. He wanted that love from his parents. He wanted to see a harmony between his parents, and he wanted to love from both the parents, but unfortunately he could not get there. This love was sacrificed, but even he got injured. So mental trauma, and then the mother started spanking him, so he got physical trauma. So it need not necessarily be that primarily he will have the only mental trauma. The body can sustain the mental trauma at a particular time, but body will gradually go into exhibition or going into reflection of the disease. But that was the physical trauma which also hurt him badly. So both the traumas contributing him, and he going into a mode of aloofness. So cheerful child, extroverted child, going into aloof kind of mode, staying alone, staying away, fear, just waking up at night. And he went to a kind of anguish phase during that time. As and when things went by, as and when time went by, body started to give up, body started to give way. So it's also very important for us to know that what is the disposition. So what is the affinity of the disposition? If the mind is traumatized, how is the body reacting? How are the neurotransmitters affecting the body? Where it is affecting, which part it is affecting, and which side it is affecting. So right side is more for the logic, the left side is more for sensitivity. Right? So this child was more sensitive, and his sensitivity was getting injured, sensitivity was getting hurt all the time. So when it is a constitution which is predominantly psychotic, it will go like a submarine very gradually, very slowly, taking all the injuries, all the imprints. So it is very important to know where after the trauma, what is the reaction. So primary trauma is sora, inflammation. Secondary is a build up on that. So secondary is an adaptation mode. So body first, there are only two reactions which can occur. Either the body can recede or take in, or body can rebel. So initially, in certain constitution, body will try to take it. Body will try to acclimatize or adjust somewhere and mold into and go into an adaptation mode. If this adaptation is not good enough, physical level as well as mental level, mind you. And there comes a part where normal individuals who are moving from SORA to psychosis, the psychosis is not generally the bad psychosis, it is a good psychosis. Because every miasm has two parts, good bad syphilis and good bad psychosis as well. So it's not always that it will go from SORA to psychosis, bad psychosis, and psychosis to syphilis. It's an adaptation mode of the body where physically, initially the body will go into good psychosis, or rather mentally more the body will go into adaptation of good psychosis. If this good psychosis is not good enough, then the body switches on to go to the bad psychosis, and from bad psychosis can go to bad syphilis. So here the child took the imprints, took the trauma, took the sensitivity inside without repulsion. If he was a rebellious child, if he was a child who would not tolerate this thing, he would have straight away gone into a rebellious mode. He would have straight away opposed it. He would have straight away went and hit the father. But it was not so. This was a timid individual. So timid personalities generally accept the trauma, adjust themselves, adapt themselves, and then they will go into multiplication. So these are highly psychotic individuals. And then adaptivity or changeability in the body or multiplication in the body then gives rise to particular pathology or reflect a particular pathology in the body according to the mental attributes. So here, as he grew, trauma, fear at night, alertness at night, love for her mother, protection about her mother, but unfortunately he could not protect. Mother insulted him, mother hit him very badly, and still he further went into a faction of imagination. So this was a boy who wanted to wander. This was a boy who wanted to go and, see places. So desire to travel, desire to wander, all these things was there, but she still went one step further. So this is the map where each and every constitution will go from SORA to psychosis to syphilis. And that is the point which we need to catch hold of, that where is this individual moving into syphilis, and how slowly or how fastly is going into syphilis, and what is the conversion rate at the systemic level, at the pathological level. So mind, the stroma already started, mind going into a faction of imagination. So here he was going into a kind of an action which was uncontrolled. An action which was uncontrolled, that means the mother would say that if I had to, he had to wander. He had initially only desired to wander. That many children have. You take them, you carry them, you see them places, you come back and keep them. They don't have a problem. But there are certain children who do not stop there. They go on and on and on and on and on and on and on. And that is not only at the mental level, because this is the mental satisfaction which they get. It becomes like an addiction to them. So that's not only a mental satisfaction or a gratification, it goes into an addiction, it goes into an autoimmune or rather automatic motion, continuous motion, it goes into a delirious state. So actions which are uncontrolled, actions which are repetitive, actions which are more like addictive, they go into a delirious state. So this boy from fear, insecurity to fear, and fear, it went into a delirious state. See how individuals will vary. Even the sulfur patient which we saw, that there was also fear. The lady which we saw, she had also fear, but individual fear, the psychosis can nurture into different zones according to the genetic evolution of that individual and the trait which the individual has. So here he was a cheerful boy. He was a kind of a boy who liked love, who liked people around, and he went to the faction his imagination faction was heightened. His imagination faction went out of control, and when that need was also not satisfied, body went into a continuous action related mode, and that action related mode is nothing but a delirious state. So he was threatening to go into delirious because his wants was not getting satisfied, his desire to wander was not getting satisfied, and when it is not satisfied, he went into action related mode, and when this repeated action happens, that is called a delirium wandering. He went into a delirious state of wandering where nothing could stop him. He had to be taken, he had to go. He doesn't stop. Mother will say, I do anything for him. He has to go. He doesn't really listen to me. But one more thing happened was still further he went it was not only the physical restlessness or the wandering or a delirium which went into a wanderous state, it was a particular faculty at the sleep also which was getting disturbed. Very important for us to know that this certain individual who are insecure, sensitive, take a spanking in the childhood, have the alertness, are heightened in the sora because of the trauma, go into the pattern of excessive hearing, acuteness of hearing, sensitive hearing, or sleep which is acute, or sleep which is very light. They have to have, if it's a vice versa thing, if you have a patient who is having this as a symptom, we can go back in the history and find out some trauma has occurred in the childhood which has heightened their senses. Otherwise, why should they be alert in their sleep? If somebody has been alert in the sleep at particular juncture, then some trauma has definitely taken place. But the expression on the sleep would be different, according to a different constitution. Somebody would have acuteness, somebody will wake up, somebody will sleep and talk, somebody will answer during sleep, somebody will talk during sleep. It will be a different expression of that symptom. So even this person was going the same way. He went into delirious physical, delirious mental wandering, but even in the sleep pattern, he went into a muttering mode. Muttering mode, he would talk about the same thing again and again in the day, continuously in the day, and he would not stop. And when this pattern happens repeatedly, it is a delirious state in sleep. So delirium loquacity, sleep during. So delirium loquacity, sleep during, because it's more with the subconscious mind as well. The body is going and destroying there. It's more with the conscious mind as well, where the wandering also is going to delirious state. So every action is all connected with the trauma which is gone there, and the psychosis was also not taken care of. Body has now gone into destruction of the higher senses. And even if this is not taken care of, further he might go into loss of identity problems, or otherwise can go into still deeper and bigger problems. So sora, psychosis, and syphilis. So I want a remedy which is fearful, extroverted, going introverted, and going into a delirious state. So delirium sleep or loquacious sleep during, delirium wandering, when this we try to cover them. We have many remedies which are coming, but the remedy which comes up is sulfur. The remedy which comes up is sulfur, and we try to analyze again, is the soric character, is the psychotic character. Yes, but now going back to the pathology, very importantly, as sir was talking yesterday, that the sensitivity of the mind, the reflection, the trauma of the mind, fair enough. The syphilitic, what you have caught, but what is the reflection on the body? How is the reflection on the body? How is the miasmatic process defending? And what is the reaction of the body? So body also got traumatized, and body went on the left side, continuously down. It was, so spine indicates family. Spine indicates respect. Spine indicates support. So anything to do with spine, anybody having problems with spine, it could be at different levels. Where higher level, if it's the nape of the neck and the head, it is the conflict with the higher subordinates, higher individuals, or higher people in the family, or higher people in the office. neck is the respect, back is the support, back is the family. So this was a boy who was a family boy. He wanted family to be there, but unfortunately it was traumatized, the Sora was traumatized, and it went this way, this way, this way, this way, this way, down, 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 down. So bending towards the left side. So his ego, his respect, our family, or his sensitivity bending towards the mother. So because he was in love with the mother, he wanted his mother to be there, but unfortunately even she was not giving him sufficient time. So see how even body will react in particular manner. So mind of the pathology and pathology of the mind. So mind will also speak the same language, body will also speak the same language. Mind has to have a syphilitic trait and body will also follow in that particular manner. So what is the exhibition of this mind-body axis? And here was a particular bending in front of his mother. So, what has happened, we don't enter through disease rubric as scoliosis or etc., etc. What we took was curvature of the spine. The rubric which also we took secondary was curvature of the spine, delirium wandering, delirium loquacious sleep during, and the remedy which came out was sulfur. Is it clear? Easy, no? Very easy, it is very easy. But, we have to walk on a particular lines to understand that. And if you understand all three connect, generally don't only run behind syphilis. Because that also we used to do a mistake. We used to run behind syphilis. But running behind syphilis in a particular manner, in a systematic manner, it's not in a random manner. Understanding what is the evolution of the disease, understanding how the disease has come, why the disease has come, what was the trauma, and now where the disease is moving, that is how we can catch the syphilis. It is only now because many people then only just start running about the conflict and the syphilis. No. We have to go gradually and in a very systematic manner. So sulfur was given to him 200 single dose, and he came to our clinic. And in that also he had stooped shoulders, typical sulfur kind, and he started working normally, naturally. It's also very important that your relationship with your family also improves. So the mother also, of course, obviously, mother had love for him, but unfortunately, she had her own issues in her family, which she was not able to pass on the love to him. He started getting enough attention from her mother. He started getting enough attention from the time she started spending time with him, and he stands, still erect, comes to the clinic, and he almost on the verge of recovery completely. This man was not able to sit. He was not able to even, take food for 5 minutes. He had to be restless. He had tremendous pain. He said, "How can I talk to people like this, sir?" And now he's saying, "Mother, I want to get married." She starts seeing girls. So he's come back to psychosis. Earlier, there was nothing of that sort. He said, "I don't know whether I will survive or not." But syphilis to psychosis. So, shall we stop here? Easy or no easy? It is very easy, provided we know how to do it. But please try to understand this before we end, with just 5 minutes. Try to understand this, that each and every disease pair is different. We have to go systematically to understand that, and understanding of miasms are very important. Until unless you clear out with miasms and the syphilitic part, it will not be clear. Any questions? Or should we stop? Okay. Thank you very much. We stop here, yeah? Thank you. Thank you.
Delegates, kindly note, the lunch break is from 1:15 to 2 p.m. at the same venue as yesterday. But the lunch will be served on the ground floor and on the first floor. Ground floor is for practitioners and first floor is for students. Kindly take your ID cards while going for the lunch. Thank you.
So today morning you saw different approaches to psychiatric cases by Dr. Amrish. And you will see how Hahnemann has already given us the outline of what to do and what not to do. It is we who have not understood him properly. And our endeavor is only to become a bridge between Hahnemann and other homeopaths, so that missing link, the understanding of that complicated language of Hahnemann, which is the obstruction to the progress of homeopathy, is removed. Once you start understanding Hahnemann and his organon, sky is the limit for your cases and for your results. This is exactly what has happened in my case, and that's why I call this as limitless scope of homeopathy. What do you mean by limitless? Limitless means limitless. There is no limits. As I told you yesterday, he has actually written in Theory of Chronic Disease that there are infinite possibilities. He has used that word, infinite. And that is very, very important. If a German uses this word, infinite, it really means something. That means he has understood that the scope of homeopathy is infinite or limitless. This infinite word, when used by an Indian, it becomes okay. Somebody just talks like that only. But when German talks, they are very, very perfect. They are very meticulous. They are very precise. And that's why all the best instruments are coming from Germany, because there is precise engineering, precision engineering, they call it. All the best of the gadgets and the modern technologies are coming from Germany, because they are all precision oriented. The precision orientation is so much that I remember when my children were very small and I visited Germany for the first time. I was traveling by train from Gare de Lyon in France to Germany, and the name of the station was Ulm. That Ulm station, from Gare de Lyon to Ulm station, was quite a distance from France to Germany, across the continents. So night time we had to sleep. Morning when we get up, I went outside and asked the TC, who was there, ticket checker, that what time is Ulm expected, because it is written about 8:10 or 8:12, something was written there. So I went and asked them, in India when we are sleeping overnight, we go and ask them, was the train standing somewhere? 1 hour late or 2 hours late? So that way I asked him confidently. Now it was 7:30. I said, what time is it expected? No, it was 8 o'clock, sorry, 8 o'clock. I said, in 10-15 minutes we should be at Ulm? No. I said, then it was late? Late by 1 hour, 2 hours? No. I said, 15 minutes, 20 minutes? No. Then 12 minutes. So when I asked him 10 to 15 minutes, he said nothing. No. But at 10 to 15 also there is 12 minutes also, no? Which for Indians it doesn't mean anything. Because there if you ask, will you have breakfast? My children were asked, will you have breakfast? I have mentioned this in many places. And, okay, we'll have. Yes. Eggs and toast. We say yes. And after some time, he doesn't offer us breakfast. I said, why? We were all hungry. And we just went out like that. This fellow is asking us but not giving us food. We were hungry. And I asked him outside when we were on the way, you told us you were giving extra breakfast. He said, yes, I asked you. You all said no. I said, yes. We said yes. No, you shook your head. For Indians, this is okay. We are all used to Bharatanatyam. And this, I don't know what is this. If you go abroad, don't do like that. Will you have tea, coffee? He says, here in Germany, it's either this or this. There's no other movement. So this is precision engineering. And that is what Hahnemann wanted. And you can see that by understanding, he has written, if you understand the logical sequence of my teaching, if you remember the words very well, if you understand the logical sequence of my teaching, then and only then you can get infinite results. Results are impossible. I mean, it is something which nobody can believe. The allopaths just cannot believe it, that infinite results can come. As I showed you yesterday, most of the cases which I showed you yesterday, at the beginning of life, something goes wrong, the child does not cry, and you have innumerable mental retarded children coming onto this world. And I dare say, see, that may be an accident that the child did not cry. Of course, nothing is an accident, everything is calculated mathematics. Everything is mathematical. But if allopathy was the right science, they wouldn't have allowed these children to become mental retarded or cerebral palsy children. 60 to 70% of the children suffer because they did not get proper treatment when they did not cry when they came to this world. They just put it into genetic mutation. This is genetically mutated. Something has happened inside the womb. They blame the genes for that mutation, and this is absolutely wrong. Even autistic children, even children who go into neuroregression. You see, I have seen mothers and fathers and coming and telling us, my child was growing absolutely normal. Until one fine day, he got this vaccination, after which he got convulsion, and after that he has never been well since. Many of you doctors must have heard this story. I don't think it is something new which you are hearing. And the parents say, I know up to 1.5 years of age, my child was good. 2.5 years of age, my child was good. He was growing normally. He was very intelligent. He was talking. He was speaking. He was hearing. He was playing. He was smiling. And then everything has started going back. And the doctors, the pediatricians say that this is because of some mutation in the genes. He was born like this, and later on it has developed. This is their helplessness which is talking. But there, if we can put our foot down and reverse the whole thing, reverse, such children will no longer remain mental retarded. Otherwise, up to 14 years, 17 years, 18 years, they all become like this, and then there is time to go up. Because mothers, when such children are born, mother and father cannot live their life because they have to concentrate on these children. And when as long as this child lives, no parents would like to die because we'll take care of them. So this is not an individual disease. It's a disease which afflicts the whole family. Why we have been concentrating on this is that this is the beginning of the life, and believe it or not, without homeopathy they cannot be helped. All these people, so-called specialists and pediatricians, what they say? That this is, you can't help it. Any amount of money you spend, they are not going to come. This child is not going to become okay. God will see that it is like that. So I'm telling you again and again that we as homeopath, I'm not boasting, I'm not a egoistic person, I'm not, whatever it is, but when it comes to homeopathy, my ego becomes very big. That yes, we are slightly above destiny. Above destiny. How do you explain these thousands of... Now we are having camps for almost 40, 42 places. We are having camps. Thousands and 2,000. Last time it was recorded in Mahabaleshwar, 2,600 patients attended. How can... And without any advertisement. They are coming from word of mouth. How can you explain that these people, these children who are not able to walk up to age of 14 years, 15 years, so they were destined to be like this. Today their destiny changes and they start walking, they start becoming independent. So this is where we are changing the destiny. You know what is destiny? Destiny, they say, is something which you are destined to undergo. No, sir. That's a wrong definition of destiny. You see? It's a wrong definition of destiny. Destiny comes from the word destination. What is destination? That now when I'm flying or when I'm coming by train from Bombay to Chennai, I have caught a train and I'm coming here. That my destination from Mumbai to Chennai. Yes, Chennai is my destination. But in between comes, what is that, Guntakal? A major junction, you know, Renigunta, Guntakal, etc. Not Renigunta? Different. Guntakal is right, sir. But you can get down and take another one and go to Bangalore. Isn't it? So if you change your train, your destination changes. So also, destinations can change, destinies can change if you have a proper process, if the proper intervention. I'll give you an example. Maybe I have given this example many times before of Ramayana. When Lord Rama was sent to Vanvas, and his father Dasharatha died because of the grief. Bharat was now given all the doshas. That means he was blamed that he was the person, he was the villain, when he was not there at all. The mother Kaikeyi had planned it in such a manner. Kaikeyi, you know? Yes. She had planned it in such a manner that all these things should come to my son, Bharat. And when he came back at home, he found that people were looking at him like a villain. That this guy is a villain. He has sent our Lord Rama, a very virtuous person, to the forest for Vanvas. He felt very bad that for no fault of his, he was now being blamed. He was being blamed. This is not my fault, but unnecessarily I am being blamed. So he went to the Guru, which I don't know what was the name of the Guru, Vasishtha. Vasishtha was the Guru. And he went and to Vasishtha Rishi and said, "Oh, why is this so? I have not done anything wrong. Then why do I have to face all this ignominy of being the villain?" So Vasishtha was a guru. When any problem is there, they go to him to ask. So naturally, he advised him, see, hey Bharat, your future is destined. That means what he said was, in Hindi he said, that, hey Bharat, bhavi prabhala, janana marana, sukh dukh, labh hani hai vidhi ke haath. So, bhavi prabhala, that means future is strong, but janana marana, labh hani, sukh dukh hai vidhi ke haath. If this was the advice for which he had gone, then what is the meaning of going to a guru? If you go to your guru with a very serious case or something complicated, and the guru says, he's going to die, why do we treat him? Isn't it? So, hai vidhi ke haath. Vidhi means destiny. Destiny. Vidhi is not destiny. Vidhi is not destiny. Vidhi, by strict word meaning, is process. Process. And that process is very, very important. He said, hai vidhi ke haath. So if you want to change hani into labh, dukh into sukh, maran into janan, then you have to change the process. Do you understand it? So Bharat did the same thing. What did he do? He took Rama's, he knew that Ram is Vachanabadha and he is never going to come back because he was Aram Metallicum. Or so. So he said he is not going to come back. He is very obstinate and he is not going to come back, reverse his decision. It's not Palsidi that I request and he immediately comes with me. So he said, he said, okay, if you are not going to come, please give me your paduka, his footwear. Bharat had carried all the Ayodhya people with him, all his people with him there to show that, see, I am requesting him to come, but he is not coming. So his side was clear. And then in front of all the big people, the people of Ayodhya, he brought this chappals and kept it on the throne from where, who ruled for 14 years? Bharat only ruled. But in the name of Rama. So by changing the process, from zero he became the hero. People thought that he is no more the villain, he is the hero. He has not done anything wrong. See, this thing is clear. See? And Maran into Janan, and Dukh into Sukh, and in Sukh he ruled the whole thing for 14 years. He just changed the process, which going towards political similarity, what Sonia Gandhi did when Congress won. She did not come and become the Prime Minister. She could have become the first Prime Minister of an international Prime Minister of the largest democracy. But she put Manmohan Singh there. But who was ruling? Sonia was only ruling. He was only saying, yes, bye. So she changed the process. If she would have become Prime Minister, people would have shot her. Isn't it? Dogmatic people would have shot her, and one more wicket would have gone from Gandhi family. She changed the process and ruled for so many years. You see? This is what is known as changing the process. Now what is the process going on in human body? Sora, inflammation, psychosis, and syphilis. Growth or destruction. So yesterday we were talking, it is only homeopathy which can reverse from psychosis, syphilis to SORA, or psychosis to SORA. We can change the process and the hand of time, going beyond destiny. What I said just now is that we go beyond destiny. If a person has got the process of growth or process of cancer, if we know the process, how to tackle the process, we can reverse this syphilis into psychosis and SORA and give that patient a longer life. Because he's sinking. Actually, it is 120 years life of human being. But we are, because of certain circumstances or medicines, etc., or even emotional conflicts, that 120 has been reduced to 100, then 90, 70, and now it is not even 50 and 60. In Mumbai, where I am staying, they have found out that the average life of a male is 52 years. That means I am 13 years, I am getting bonus. So this is already living on bonus. So this is like a parabola which has started to complete 80 years, but it is ending up in 60 years. But if we have, or rather 50 years, 40 years, 30 years also, with renal failures and cancers. So if we can reverse the process from syphilis again this way and put him into the same orbit to complete the life of 80 years, then only homeopathy can do. Nobody else can do. That's why homeopathy is, as I told you, is going beyond destiny. I said I'm not boasting, but if you learn homeopathy properly, it has got the capacity of lengthening the life or reversing the irreversible. And that's why he has said that it is infinite. Limits are infinite. You know, he has said that whatever you can achieve is infinite, and that limits of homeopathy, if you understand properly, today, you know, I used to get, when I was studying in my college days, in 1969-70, when I used to study, there was a question, what is the limits of homeopathy? And we had to write down, hernia, autoimmune diseases, etc., etc., etc. What doctors cannot cure, they will tell you to write down. Tumors, so we have to go in for operations, etc. The limit of homeopathy is the doctor himself, homeopath himself, his knowledge. As he goes on getting better and better, its limits become bigger and bigger. There was a time when I was young, asthmatic used to come outside and I used to get frightened. I tell him the doctor is not there. What if he goes into status asthmaticus? How will I handle him? Because I did not know what to do at that time. See, I passed through this phase, that's why I'm telling you all that. We used to treat cough and cold, it would go into pneumonia, and that pneumonia, Kalikar, Kaliars, and nonsensical, and Timtat, all these medicines, we used to just repeat and repeat, and the patient used to land up in hospital on oxygen or nebulizer or something like that. This is because I did not know how to treat asthma. I did not know how to treat emergencies. It was my limitations. So the limit was mine, not homeopathy. If at all anything fails, it is the homeopath who fails, not homeopathy. But that is what we need to strengthen our foundation. We need to strengthen our foundation that it becomes limitless. One more case, yesterday I promised you, that's why I'm showing you that case again. Similarly, a child who was destined to become unintelligent, destined to become mental retarded, destined to have so many problems. Just because father and mother fought one day before. Before that child came into this world, father and mother, nowadays, at least in Bombay, both are like, boxers, WWF. Sometimes husband is on the top, sometimes wife is on the top. but it is not pre-planned like WWF. Otherwise, in WWF, that one person will climb up, and when he jumps, he safely moves aside, down. Only noise comes out. So this is not like that. So this mother and father fought first verbally, then physically, and the mother started hitting the father. The father became very angry. Father started hitting mother. So when she got so much hit, then she said, forget it, I don't want this child. So she started hitting the child. I don't want to become the mother of this child. This is what tempers can do. Tempers. So this is such a thing, and he is, of course, this, I know everything because my fast friend's son was the father and his wife, daughter-in-law. Let us, कुठे हे काय केलं? हे नाही काढलं. मी काढलेलं आलं ते याद आली. अरे आता काढलेलं मी. नाही, you open the, where is the, ते नाही, हा, you put. असं नाही करायचं. हा. So when this child was born, the child was first of all premature. त्यात लिहिलेलं आहे मी. Here are new folder in secret. हे बंद कर. तेच आहे, but not like that. Don't open from there. नाही. अच्छा आला. हा ला. नाही. Only that. It will not work, but you have opened it from the wrong side. बघूया तो if it works or not. नाही तर मग you have to go back again. नाही, this is wrong. Blue नाही, red येतं. Blue नाही येत त्याच्यामध्ये. सांगतो तसं. Go to this. Open कर. The video will not work. हे बंद कर पहिला. Here new folder काढ. नाही. मी सांगते तू तिथे ओपन करते, परत तिथे सेटली, and then you, no, don't open from there. See more results. तुम्ही उघडले, हा तिकडेच आहे बघ तो. Tiara new folder. Tiara new folder. Not latest. No. अच्छाच आहे. इकडेच आहे कुठेतरी. TIARA. Yoga. No, that should be blue, red, not blue. Here a new folder ne आलेला. And this is right. So next book. Come back again. Come back. Cross kara. Okay, let us see. See, everything is saved. Come on. So So this child was born at 36.5 weeks, no cry at birth, admitted to NICU at Lilavati Hospital. Go ahead. Born at 36.5, there are a lot of things which were written by the hospital. Go ahead. This is the main periventricular infarction of intrauterine event with acquired hemorrhagic disease of the newborn. That means this child was found to be having, they thought, query thalassemia, some bleeding disorder, that one of the clotting factor was missing, something like that. So this was because one day before there was a fight, and then she started getting pains. At night they had to rush, and then she went into a prolonged labor with depressed fetal movements, vaginal delivery. Baby did not cry immediately at birth, clinically depressed, no spontaneous respiration. Baby was transferred from Beans Hospital to Lilavati Hospital and admitted to NICU. Heart rate was 158, respiratory rate was 60 per minute. That is the crux of the whole thing, what is written. Go ahead. This was how the child was born. It is not a chicken, it is a child, human child. Go ahead. Go ahead. This is the father. This is not doctor, but this is my friend's son. Next. Next. Large soft swelling was observed in the right parietal region of the head. Blood was observed at the anal orifice. Urine was slightly reddish. Urine showed RBCs. MRI and blood investigations were carried out immediately. Go ahead. There was a hematoma. If you can see that redness spreading from one side to another. Next. The partial thromboplastin time, PTT, is equal to 114. Actually, it should have been 26, and prothrombin time was 24 when it should have been 10.7. Next. It was 27/7/2007. So they said blood clotting disorder like hemophilia. Next. Jugs were observed in lower. Can you see that? Lower extremities, jugs increased to the whole body. Can you see that? What does this mean? What does this mean? Huh? What does this mean? Pathologically, what does this mean? Huh? Is it inflammation? Irritation. What can irritate a brain on first day? On birth. Hardly, first day of birth. What can irritate? Or a bleeding, isn't it? You saw that bleeding is at the anus, bleeding in urine, bleeding here, bleeding here. So if here there is bleeding, why not inside? Because the PTT is so high. PT and PTT, both are very high. So there is a bleeding disorder. That is what the doctor said. That is born with such a disorder. We are sorry, very bad case. You'll have to treat that. Go ahead. So MRI. I don't know whether you'll be able to read this properly. So what has they have written? Patchy areas of restricted diffusion in peritrigonal white matter suggestive of acute infarct, probable laminar necrosis. If somebody gives you such a report on the first or second day or third day, the person who is reading the report doesn't know what he's doing. Because infarct, okay, but laminar necrosis cannot occur in such a short time. Remember to use your miasm knowledge everywhere. First is only irritation, injury. And second, then comes induration and thickening, restricted diffusion, no? Second. Now this was, when was the child born? What was the first report? What is that? 27/7, no? Piche? Anyway, 27/7 was the birth date. So, 27 to 30. In 3 days, the chakra of psora, psychosis, syphilis doesn't move so fast. So necrosis is not possible. Because they are not getting a clear image, the pickup of this thing is not proper, their dye is not proper, they are just mentioning it as a necrosed. It cannot be. On the first, second, third day, necrosis cannot occur so fast. In homeopathy, we have this compass of psora, psychosis, syphilis. What is psora, psychosis, syphilis? It is not a disease. It's a fighting process. If anything can go fast so much, I mean, any disease or any person can go from psora to psychosis to syphilis in 3 days, means first thing is that person is very yielding, he's not fighting. That constitution is not fighting at all. We are given these arms, weapons, defense mechanism by the Almighty so that we survive, we live. This is not seconds, like we call it seconds kamal. That this is, it can be so bad. It cannot be so bad. So this is wrong. But then, what was seen was cerebral edema. Edema is possible or not possible? Yes. From irritation, the second defense is edema. Irritation, when the blood has touched the brain somewhere, now the irritation, the blood has no business to touch. You know there is blood-brain barrier, no? In brain, do you know that? That the blood is not supposed to touch. Blood-brain barrier is there. Now the barrier, the vessels are broken and blood has touched there. So if somebody touches your throat like that with something which should never enter your throat, you are going to get inflammation. So irritation and inflammation is there. Inflammation causes edema. Isn't it? So, Kefal hematoma, yes, because the blood vessels are very brittle and blood is oozing out. No clotting is there. Cerebral edema, possible. And cerebral hypoxic insult, possible. But not laminar necrosis. Never. So, we as homeopaths have to understand this in terms of miasm. That's why Hanuman has said, dare to be wise. You know that, no? Our motto? What is it? Aude sapere, dare to be wise. If you know your miasms very well, you will dare to be wise and you can challenge any allopath that your diagnosis is wrong. It cannot be so fast. Necrosis cannot come so fast. So, okay, go ahead please. So 27th again, TSH was also done and they found 32.8853, so much high. It has shot up. Then, what else? This was later, this was first. On the first day it was 114, same thing, no? What was the previous one? Same, okay, go ahead. Hemoglobin was okay, 13.7, slightly low. Erythrocytic count, 4.5, again low, 4.4, again low. Hematocrit, 39.5. RDW, 15.3. You know what is RDW? What is RDW? It is two RBCs when you combine them. The center to center distance. RBC distance, that is the two distance between the two centers of the RBCs. What does it suggest? It's very important for homeopaths, mind you. That's why I am telling you all this. Miasm should be seen here also. RDW, if it increases, means the size of the RBCs is increasing. If size of the RBCs is increasing, the distances go further. Then what is the miasm? Psychosis. Because blood cells are now bigger in size. Hyperpsychosis. Psychosis which are making the blood cells bigger. It should not be bigger also, not be smaller also. So when it is too big, then it is syphilis. RDW is almost 20, 25, 23, it is syphilis. So when you are giving the right remedy, an ordinary blood CBC will tell you whether the remedy is right or wrong. Because body starts producing blood cells, RBCs, which will be smaller and smaller, not bigger and bigger. Because psychosis means big, but inside there is nothing. Isn't it? Psychosis is the most dangerous thing. Outside it looks so big, but inside there is nothing. So remember this. It has RDW is 15.3. That means it has just crossed the limit and just gone to psychosis, second defense mechanism. So neutrophils, when does neutrophil increase? First defense. First defense, that means soda. When there is an infective stage, when there is inflammatory stage, it will increase. That means there is some acute infection and the body is trying to fight. If there are some riots here, you will find some, not riot, but something which is, some students have protested and all, then only police coming. Police are neutrophils. For ordinary problem, they are okay. But when there is a major problem, some two groups are fighting and they are creating a riot, then you have to call the reserve police, CRP, SRP, and then there is a communal riot, then there are some people are stationed there. Then they are psychosis. That means lymphocytes. The lymphocytes are, that means there is a chronic problem. So whenever there is a tuberculosis or something which infection or inflammation which becomes chronic, then this thing is more. So now we are seeing here that it is going from acute infarct trauma to now gradual perilesional edema, that is psychosis. RDW is also increasing, lymphocytes are also increasing, and fighting powers decreasing. Unfortunately, our people do not, allopathists do not understand all this. How to see the report in terms of miasm. Each and everything can be interpreted in terms of miasm. So remember this, whenever lymphocytes reduce and neutrophils increase, the patient is coming back to normal, to SORA. From syphilis to psychosis to SORA, or from psychosis to SORA. RDW also comes within that 14, 12 and 13. It's very important. We know that my medicine is working well. Only from this you can conclude whether patient says I'm better or not. Only from the blood report, because blood report cannot be influenced. It is natural production of our cells in order to survive. So when the bone marrow starts producing everything properly in proper amount, you know that already improvement has started. So don't think about, oh, he's still not mentally well and this and that. Mind, as I told you, is not so important when a major disease is there. Mind is important only when there is an acute physiological problem. Okay. So here we are. The platelet count and all is all within normal limits. Next. Go ahead. The young parents were told that this child was never going to be normal. The child that had not cried at birth and hence had cerebral hypoxic insult. They were told that the milestones would be delayed and even the child would be mentally retarded. Just imagine when the young parents are told that your child is going to be mental retarded, he will not have mind, he will have cerebral palsy, etc. What is the fate of the children? The child probably had prothrombotic disease since birth and could bleed anytime, anywhere, which could endanger that child's life, her life. Then by birth, she had also thyroid dysfunction, and this could last lifelong. So it's lifelong, she'll have to take thyroid tablets. For 6 hours and 10 hours, child, they are telling, throughout her life, she'll have to take from this also, thyroid medicines also, and other things also. Something to increase her clotting time. Go ahead. So this is that history which I already told you, that they were both angry and they had physical fight, WWF, and she shouted and screamed that I want to kill this child. I want to kill this child. Within few minutes, she started getting pains in the abdomen and was rushed to the hospital. Labor pains were ineffectual and delivery was unusually prolonged. Again, everything is mathematics in the world. She got angry and she said, I want to kill this child. And the child, do you think the child does not understand this? It does understand, no? Yes or no? In our mythological books it is written, no? Abhimanyu, Chakravyuh mein phas gaya tu. So he had also heard. So this girl heard it, immediately said, Abhi idhar se bhago. You have to run away. This lady has gone mad. Berserk, she might kill me. So it has to be a very sharp and timid and sharp constitution. The constitution has to, that I will come out of this. It is better that I come out. But the time was still not ready. The whole thing was not yet ready. And she got stuck up. Because this thing was not ready to throw it out completely. And then there was a prolonged labor. Next. When I saw that girl, she had right-sided swelling of the head, right leg was shaking and jerking often, but only when the child was sleeping. Then later both the legs showed jerks. History of blood was there from anus as well as urine. That was because of this only. Next, please. So I needed a remedy that was a bleeder, with a bleeding from many places, was during sleep, has to have jerks as in convulsion. Next. So we just got together all this. If you go to see ailment from anger also, if you add to it, we'll see it later on. But hemorrhage tendency, that is the effect of the, what effects has this thing had? Anger had on this child. End result was that hemorrhagic tendency, jerking and sleep into aggravation. We have all these remedies which are coming out. China, Crocus, Crotalus, Ipecac, Lachesis, Phosphorus, Sulfate, Zincum. Go ahead. This is Dr. Udani, which is one of the best known pediatric neurosurgeon and neurologist. And she said, leading this thing, what she had said was, many thanks, I viewed the MRI study of the brain of the baby Vinita, but what did she say? T1 images acquired in sagittal and axial planes demonstrates smooth, linear hyperintensity along the dural surfaces of dural venous sinuses, including superior sagittal sinus, straight sinus, and both horizontal sinuses. The intraluminal signals with sinuses is so intense, iso-intense to hyper-intense, which would be highly suspicious for sluggish flow or acute thrombosis, etc., etc., etc. I think these findings would be highly suspicious of underlying thrombotic venous disease, and prothrombotic stage would have to be excluded. I suggest a gadolinium enhanced MRV study for further evolution. So they go on, it's a chain reaction. You have given me this report, take a gadolinium study report, etc., etc. But what to do, they don't know. Next. We gave the, what medicine did we give this child? Go ahead. Virus कधी आला? मला हे नाही आहे. अच्छा मला आलं नाही. Yeah. The another, this is USG of skull. Large Kiffel hematoma noted. No obvious intracranial abnormalities seen. Next. Just go on reading that. Go ahead, go back. Okay, let us see now what was the remedy given. So it was very obvious that this child, go back only, and then you come to this. What is that? Zincum, sulfuric acid, phosphorus, lachesis, ipecac, Crotalus aureus, Crocus, and China. These were all covering this particular, this effects. Now we have to add to it ailment from anger. Isn't it? Because all this has started after anger. When anger and these two are added, the only common thing which comes up is China. But in anger, China will get only 1 mark. 1 mark. Ipecac and lachesis. Only 3 remedies come after you add an ailment from anger. Ailment from anger, only 3 remedies are coming. So lachesis, China, and ipecac. It was decided by me that she has to be a Ophidia. Why? But The only problem was that it was not going from left to right, but it was going from right to left. The bleeding, the hematoma was going from right to left. Bleeding from all orifices. This is crotalus horridus. So what I want to tell you is that when lachesis comes, does not mean that you have to give lachesis only. It can be any of the ophidias. You have to broaden the whole thing. So the remedy given was crotalus horridus, 30 single dose was given only. And you'll see the results after a few days. Go ahead. The T4 came down. TSH came to normal, almost normal. That was before. Go ahead. And this was in the September. No, September. That was in July, no? Now, this is very important. Previously marked, can you read? Because if I go near, I cannot read. Previously marked. Khali was. Third paragraph also. Your second person was there. Previous MR dated 26/7 was available.
Previously seen large bilateral ill-defined hyperintense areas of restricted diffusion on the MR dated 26/07/2007 show almost complete resolution on the present MR.
So all the bilateral ill-defined hyperintense areas of restricted diffusion. Restricted diffusion is what? Miasm? Psychosis, no? Thick skin. So if the whole thing becomes thickened, diffusion becomes restricted. And that is how a hypoxic injury goes into a mental retardation. What happens? First there is inflammation. That inflammation becomes chronic. Chronic means thickened. And after it becomes thickened, the diffusion is not possible. Diffusion of oxygen, nutrients, etc. So the inner cells suffer. They suffer and they start getting atrophied. And then leukodystrophy starts. So you'll observe that in such cases, first there is brain injuries, you will find that the patient is going into convulsions. After some time, convulsion reduces. As allopaths give wrong medicine, inflammation is suppressed and induration takes place. Later on, when the parenchymal cells become psychotic and shriveled, then their whole internal this thing changes. Cyclical AMP-GMP ratio changes and patient starts getting convulsions again in the second. So that is psychotic convulsions. And the leukodystrophy starts taking place, that means syphilis occurs. So the child who was intelligent now becomes unintelligent. His intellect also goes away. So remember, SORA, psychosis, goes to syphilis. We caught hold of them at that times, in the psychotic phase, when restricted diffusion was there. And after 1 month, we saw that no restricted diffusion was there on the MRI. Saw that? There are no new lesions seen in the brain parenchyma. And there is no area of restricted diffusion at all. Then when ventricles are normal, myelination pattern is normal. Myelination pattern changes after 6 months, 8 months. So first time in the initial stage, you will have a very normal brain brain scan. After 9 months, then the doctors will say, he is retarded, get another this thing done. And then you will find leukodystrophy, parenchymal destruction, demyelination. This is an after effect when the disease has gone to syphilis. But why are you allowing it to go to syphilis? I argued with them, there and there, with the neuro physician also and with the pediatrician also. I said, you are doing a wrong thing by suppressing this irritation and the convulsion. Please stop the anti-epileptic. Just, do you mean to say that we have to throw in the gloves? That means we have to surrender to the disease? Anyway, so previously seen marked heterogeneous signals within the venous sinuses have completely resolved on the present MR. There is a mild low signal seen in the left transverse sinus on MR venogram, which shows good flow on the contrast study. There it was poor flow. Now it has all become good. Then this Meher Ursekar, who is supposed to be a specialist, super specialist, supervisor, she writes, Dear Dr. Udani, many thanks. I have reviewed the case of Vinita Puruswani. I had earlier commented on the study which had been performed at 5 days of age, and on which I had suspected there was sluggish flow in the dural venous sinuses and medullary veins, causing parenchymal changes with mildly restricted diffusion with left temporoparietal white matter. The subsequent study has been performed a month later and shows resolution of all parenchymal abnormalities without obvious residual scars. I also see no evidence of stenosis or occlusion in major dural venous sinuses. So besides workup for prothrombotic stage, I would also consider that the previously seen cerebral swelling may have been due to some only metabolic changes. See? They will not admit. Of course, they don't even know that she was on homeopathy. So let us see what. Go ahead. This was her pre-birth state. This is my friend's son who is explaining this to two foreigners who had come to my place. What had happened? This is the father. This is Dr. Ursula Fry, MD, and Dr. Gunther.
So as a result of Dr. Chittal, who was the pediatrician during the time of the delivery, we were just observing her, trying to make her cry. But there wasn't any big cry as normally it would be. There was small and that's it. She had, my wife had a 14-hour labor, and if you see the impact it had on her forehead, it was pretty severe over there. So what happened was, when we took her to the hospital, the next day we realized that there was some swelling on one side of her forehead. Over the next couple of hours, that entire swelling covered the entire head. And it was all, very soft. It was like liquid is filling inside. So the doctor said that, it's probably it's blood over here, hematoma, and it's not clotting here. If so much blood is accumulated somewhere, why is it not clotting? So then we realized that, her blood clotting was an issue. Along with that,
they got her blood tested.
We got her blood tested.
And they found report suggesting hemophilia.
Yeah. And then also the doctor suggested that there were some suspected epileptic movements.
The right?
Right leg and right hand, were making some kind of epileptic movements. So they put her on Gardinal for some time, just to suppress all of that. And after Praful uncle came in and he gave her medicine and asked doctor to pull her off the Gardinal. And she's not had any kind of epileptic seizures, or we don't even know if they were, but her blood clotting is back to normal. There is no fluctuation
in between she developed even thyroid
problems. I have all the blood reports, all the CBC reports, all the clotting reports, And I remember this one day that we were really hoping her swelling was going to go down, and it hadn't gone down in a few days, and they started some special medication for the swelling to go down. And I called up uncle, I said, "Uncle, her swelling's not going down. These guys are getting a little paranoid over here." So he said, "Sachin, today the swelling is not going to go down. I think it was a full moon or something." And he said, "Today, don't give her anything. Whatever you give her, the swelling is not going to come down." He's like, "Wait for so and so hour to pass and then watch the improvement." That's what we didn't give her any medicines. And this is uncle outside the pediatric ICU, and giving instructions to people inside the pediatric ICU, and they were all just following what he said. And as soon as the end hour passed, the swelling came down automatically. It was phenomenal. Everyone was amazed. Yeah, she is a little over healthy also, but no problem on that. I mean, it's all thanks to uncle. He saved her. My God. I mean, if we go as per what a lot of these doctors say, very defensive method of treating. For almost a month, she was every day on such heavy suppressants, Gardinal, I don't know what not they used to give her.
Thyroid also?
Thyroid. I never gave her. He every time told me, "I'll show you thyroid reports, show huge numbers, huge abnormal reports." And I had to give her medicine for thyroid, but not once have I given her. He said, "Wait, don't give her these medicines, I will bring it back." Within 1 month it was back to normal. 1 month, 2 weeks it was back to normal. And it shot back to normal so soon that we were expecting it to go the other way around. So we took her for her regular checkup once, and he saw her and he said, "Sachin, I'm not going to ask you if you're on my medicine, but tell me something. Is this girl on homeopathy yet?" I said, "She's only on homeopathy right now."
No, he asked him, "Are you giving something else?"
Yeah. No, I said, "Yes, doctor, I'm not going to lie to you. I am giving her. I'm giving her uncle's medicine, Uncle Praful's medicine, and no other medicine as of right now." And he's like, "My medicine cannot explain this
drastic improvement."
Drastic improvement. And I'll also tell you that when she was born, because of the trauma during delivery, she was also diagnosed with hypoxia, which was detected in the MRI. And we sent the report to a MRI specialist who confirmed the same. And then we took a second MRI, and this is, I think, about at 6 months. Of course, for the entire 6 months, she was on uncle's medication. The same specialist gave a report in language that I've never seen any medical person write before. "This is a miracle. I'm not too sure how this has happened. Everything that I have stated in the earlier reports, I'm refuting the same things now. The cerebral hypoxia has disappeared. This is gone. There is no there's no unusual electric activity. Everything's fine. This child is good. I'm not too sure how this has happened."
This is how this child was saved. Otherwise, this child would have been another mental retarded coming to our camps. Isn't it? See how she has become now? Quiet. अभी नहीं कर दिया है. I was so excited when she was doing that.
She's staring, she's looking around.
Look here. Yara.
High five. High five. Who's that?
बात कर दिया कि नहीं? Come. Look here, Tiara. Tenth month, na? So, this child now, leave aside being unintelligent, she has gained, she's become very intelligent. But what else should follow? Can anybody tell me? With the right medicine has struck well, only one dose was given. Believe it or not. Crotalus, Aridus, 30, only one dose. Tell me, what else should happen? Huh? Not Ehrings law, though, we have seen. No, what is it? Parents stopped fighting. This is beyond. This is something which is beyond. So when the remedy is right, it will, सारी कायनात तुम्हारे पीछे खड़ी हो जाती है. Huh? You want to tell something? About what?
I have seen on the Discovery Channel that as soon as the snakes उसके बच्चे जब अंडे से बाहर निकल आते हैं, then immediately the male snakes runs after that to eat them.
I don't know.
No, this I have seen. This I have seen on the TV. It's on the Discovery Channel. And then और उसके बाद मैंने कुछ ऐसा relate करना चालू किया in the clinic of my wife कि अगर जो जितने भी पेशेंट्स ओफिडिया प्रूव हुए हैं, मीन्स उनको मेडिसिन के बाद वो क्योर हुए हैं, एंड दोज आर द ओफिडिया फॉर श्योर. उनके बच्चों में और इसमें सेपरेशन श्योरली हुआ है. और
whatever it is, but we are going beyond.
नाही सर, ज्यावेळी तुम्ही मगाशी ज्यावेळी म्हटलं की इट वॉज श्युअर ओफिडिया.
So from my way, I have decided ophidia. There may be so many other different ways of looking at it as an ophidia also. Now, okay, before we end up, now she's grown up like that, but this was way back in 2008, the mentally retarded child, so called. Still further, now she has got a small child. See, they got together, the mother and father became so pally with each other that they now migrated to US. And when I went last year, in 2015, I had gone there, they came all the way to meet me at California. And now she's grown up, she's got a younger child, not this one, see this, the middle one. This is this child. This is. So long follow-up, no mental retardation. She's very, very sharp and always stands first. So that is what we can do with homeopathy. One dose can change your destiny, isn't it? That's why I said, what did I do? I just changed the process. I changed the process. Did I cure her? No, sir. She cured herself. Remember, your medicines do not cure. You also do not cure. When you are giving medicine, you are just stimulating the patient to cure himself. It is the patient who has to cure himself, not we. We should give the right stimulus. I got that right stimulus, I gave the patient, and the patient cured himself or herself. So remember, don't be so egoistic and say, I have cured it. No, you are nobody to cure. It is that patient who has cured himself, you have stimulated the cure. Similar to what the holy men, saints, whether it is from Hindu or Catholics or Muslims, when they give dua, shafa, blessings or whatever it is, ashirwad, it is just a stimulus. That's a stimulus. And all the gradients start flowing in the right direction and the patient starts getting better and better and better. Patient has to cure himself. We are giving them only placebo. Here I have not given placebo also. Because he was my friend's son. And I did not need to. So this is the beauty of homeopathy. Anyway, so we go to one more case which is already a old case, but just because yesterday I promised you all, I am showing you that case. But I have something more to tell you in that case. I think this case we had seen at Munnar. Which year was it, Dr. Ladar? 2006. This was a girl who could not move her hands and feet. She could not even sit. I took this case live on the stage, like how I am taking right now. So I made this child sit on the chair. The child would slump down because there were no flexors which had developed. This is for the benefit of those who have not seen this case. And I was asked by many doctors, what can we do in such a case where there is genetic mutation? Because this thing showed that it is genetic mutation, and mutation showed that flexural agenesis. That means the patient could not have flexures at all. Cannot develop flexures. Before I go to this, I'm just getting confused. I wanted to tell you something about a previous case. That I told you that this child wanted to come out because the mother was after her to kill her. And that also tells you the constitution or the mentality of that child. The child doesn't want to get killed and wants to escape. So escapism is also one of this thing of Ophidias. Ophidia escapes. Then it comes and takes revenge. Ophidia will never stand in front and try to attack you. Never. It will plan out its revenge and then it will come out. And that's why basically timid. What we were taught in the college, Ophidias are angry and they attack you. No. It's wrong. Ophidias are timid. The most timid animals. They'll run away. If you are walking and there is an Ophidia, it will go away. It will not come in your way. Unless you stamp on it. So that it's only vindictive, but not an angry. So when this happened and all metabolism, when the anger was there of a mother and father, metabolism changed inside, the thyroid went up, thrombocytic, this thing, what you call as clotting factors went down, etc. So why did the clotting factor go down? Why did she develop bleeding? See, everything has got a reason. Everything has got a reason. If there is a certain thing which has happened in your metabolism or biochemistry, there is a reason behind it. If thrombocytes go down, what is the reason? Platelets go down. What is the reason? That I want to bleed. Body thinks that it is too thick and this might get clogged. So I want to escape. So here also, when the patient got angry, remember that when the patient got angry, the blood pressure rises. When the blood pressure rises, blood, it has to come out. Previously they used to put leech to make the patient bleed. Body does it on its own way. It tries to push down the thrombocytic factors, the clotting factors, either of the clotting factor, we don't know which was missing or which was less or more, less only, not more, and she started bleeding. So what I am trying to tell you is that start thinking in that pattern, that if anything has happened in the body, it is because of a reason. It is because of a reason. Why a body increases the platelets or decreases the platelet, there has to be a reason for that, which will be exactly opposite of what is happening. That means if there is a bleeding, that means body doesn't want blood to become thicker and so that the blood pressure should not rise. So she got scared when the mother's blood pressure went up to hit the child, hit the child also and mother also. This child also got scared. I better bleed out. I throw out my blood. Immediately an information is given to the physiology that reduce the clotting time, increase the clotting time, bleeding time, let me bleed. So that the BP comes down and because I want to survive. Do you understand this? It's very difficult with the first process, this thing to understand. But remember, this is the way. So here, if there is flexural agenesis, what could be the cause? Yes? What do flexors do? You start from there. How does flexural muscles help you? Only this much, not to show body. One thing is that it has to balance the extensors. It has to balance the extensors. But what is the meaning of flexors not developing? Yesterday I told you, why did that child not have collagen, proper collagen? Because it did not want to defend. Mother told her, gave the information. What is the sense of defending when nothing is going to come out of it? Isn't it? So here, what is flexion done? Bending. You are right. Flexion bends. Extension stands straight. So here exactly opposite. The mother must have had a feeling that it is useless to bend before others. Let only extensors be there. Are you understanding this? It's a different concept. It will gradually sink in. But you will see when a small child is brought before you and the child is like this, opisthotonus. Small child, I'm talking about also. Even elderly also. This means what? I am not going to bend. I am not going to bend. I am the Lord of all I survey. So the people who get this are children who are like D. Who are D have to be very obstinate, have to be very angry, aggressive, all sorts of egoistic people will go into this manner. Their extensions will be more marked. Whereas those who are always like this, you must have seen today his case. He was like this. Right? Why did he bend? Because he doesn't want to, he is not very. Sulfur. So sulfur, he is keen in, he is ready to bend anywhere. He's ready to sit here also. He doesn't mind wearing torn clothes and coming here. No? You understand? But these sulfurs are also different types. There are some sulfurs who have lycopodium traits. There are some sulfurs who have got Naxomica traits. They are complementaries. And some sulfurs who are arsenic traits, who are very fastidious sulfurs. And there are fourth type of sulfurs who are pulsatilla, meek, changeable traits. So sulfurs also have got different. That's why it is known as polycrest remedy. It takes some of the symptoms of the complementaries. So here, this child did not develop any flexures because the mutation occurred somewhere in the mother's womb. That mother said, no need of bending in front of anyone. Go. So I saw that it was a very sweet child. I think everybody had seen that child. And I thought sweet children are carcinosin, phosphorus, chocolate, palladium, arsenic. These are all sweet looking children. Sweet children who are very sweet and they are only very impress you a lot. Okay? Go ahead. But what I saw was that child was constantly, in spite of her flexures not working, she was constantly pulling up her shirt from here, like that, with only one finger. And that the father confirmed that it was also at home. So this was the most peculiar thing. Though hands were not working, she was trying to put up everything up there. She says, whether it is hot or cold, same thing is happening. And on that basis, we said, desire to uncover the abdomen, and we found out how many medicines are there, out of which we got phosphorus as the remedy. Phosphorus 30 was given, isn't it? 30, right? And we'll see that only just abdomen, clothing sensitive to, wants to uncover. And we have phosphorus. Not cuprum, not belladonna, because they are very strong. Go ahead. Go ahead. See that it is happened. Second last. This was after about 6 to 8 months after our treatment. Before, when she came, she could not even sit. Now she started. And then she started walking independently. And then in 2010 Kerala seminar, we saw her back. Come. This is your father. Your father becomes independent.
And we are all thanking to Allah and for the homeopathic leader system, and because he was not enough sure about that. Whether she can stand or walk in front of our house, even in our house or in our roads. But now we are proud to say that she can dance she can dance now.
She can dance also.
She can do everything. Even she can do dancing, singing and everything she is doing. We will do and with the maximum support to her to be a good homeopathic doctor.
Now, this is something very interesting. दूसरा चला दीजिए हाँ These lines, which lines have come now?
This.
These lines, which lines have come now?
This.
She had no creases, palm creases. The lines have started coming. Generally, they say once it is not there because they have no other treatment for it. Here, the creases are developing gradually. What do you mean by that? That means the connection is now coming in. These are all nerve endings which give you the connection, right? Go ahead.
Line, this transverse line has come, and these small lines. This was there since beginning.
But this, see now I can see some line developing here also.
Also, on the fingers.
On the fingers also, small lines. This
lines.
What is this? Now these lines are coming. Why these lines are coming? Because flexors are developing. There were no flexors only, so there were no lines in between. Now she's developing flexors, so it can now bend. Like you will see this like a small child only, no? No flexor lines. Go ahead. Yes, even finger lines have started coming. Show that.
Show this finger.
Left.
Oh. This was there since beginning. This has come now. These small lines and on the fingers.
So which side is more and which side is less developed? Left is more developed, right is less developed. Why? Phosphorus. Because of phosphorus. That constitution. Yeah. This line is developed. This was in 2013.
Okay.
2015. Only one line is there, no? One line and all small lines. And now in 2016, party like them party. No, don't pay this. No. See that. You can see this heart line also developed now. Lifeline was there only. But heart line is also developing now. And mind line also. See the 2016? I mean right side, left side. You can see the plexus developing. No, you show me that. Show. See how clearly the lines have developed now. Can you see that? Very clearly now? All lines have been developed. Show me the other one. See, like a normal human child, hand, palm. There's one case of where my brother was treating. He is an elderly man of 35 years. But he had no thumbprints, so he could not get Aadhaar card, he could not get passport, nothing. So my brother treated him. Now he got the fingerprints and he got the card. So this is again limitless scope that we only with homeopathy it is possible. If you tell these allopaths, they will say these people are mad. Okay. One more case, or I think you all are going now, no? Somebody, last case. मग दाखव ना. हाँ दाखव ना. ते बंद कर मेला. हाँ पहिलं बंद केलं. हाँ तीच आहे. This is a case of a child who developed muscular neuroregression, query myopathy, query dystrophy, query neuroregression. बघ दाखव. त्या माईल पोरीला दाखव ना. नुसतं फक्त हेच दाखव. पहिलं दाखव. पहिलं फर्स्ट पार्ट. नाही फुल नको दाखव.
अरे उठो उठो उठो.
This was her condition, that she could not even lift her head. She could not lift her head. You saw that. Instead of lifting the head, she only fell down. Once she got up with difficulty. Second time she again fell down. Tell me the reason. What can be the reason? Those who have done my CPH course, let others also try. Yes? There has to be reason for everything, no? Allopathy will say, autoimmune, autoimmune. We don't know what happened. But anything happens because of the mind working in manner. So now first of all, is it her problem or her mother's problem? Mother's problem. Because at this age, you do not get that much conflict which can affect your body. So it has had to be that the origin was in mother. So what have you to probe for? It's easy. Homeopathy is very easy. What is this? Man. What do you call? This is honor, respect. गर्दन उठा के चलना. In Tamil, what you call for man, neck? Man only, no? Neck is called Gard. Neck. गलत.
கழுத்து.
It's
கழுத்து.
கவித்.
கழு. KAZHTHU. KAZHUTHU. Actually, the right THU.
Kahatu. Sorry for my pronunciation. Okay. Huh? Karattu. So, at least it is associated with respect. Why? Why this is associated with respect? Huh? Yeah? Yeah, but why, I'm asking them, why it is called as, why it is esteem related? It is going to the head, yes? See, when man has evolved from animals, isn't it? Animal was like this, on 4 legs. Then this gradually he came up like this and like an ape man, isn't it? But when he got more and more intelligent, he started putting up his head. I am the most intelligent person, isn't it? So this intelligence went to his head because he became now the king of all his surveys. You understand? That's why that esteem has come because he gained prominence among all the animals. No animal walks with a head high. He's only dangerous animal called man walks with his head high because he has got thinking powers. That's right. So this is esteem related always. So if at all, if there is a problem here, it is esteem related. So what can be the problem there? What all sorts of problem can come? One is either falls down, falls behind, falls on the left side, falls on the right side. Or it is contracted on the left side or contracted on the right side. But every process, every what you call as distortion will have a different meaning in the mind. Will have a different meaning in the mind. What is it? Okay, here that you are ashamed. You are putting down your head in shame. Isn't it? Because somebody has insulted you so badly. What about this? What about this? Anybody? Tell me first of all behind. Huh? Head drawn backwards. Huh? Okay. That means it is not falling down. That means it's not the flexors which are the ones which are pulling it down, or not the extensions are not able to hold it up. So whenever a person is not holding up, that means it is that he has got some problem with his esteem. But what about this? Huh? This is not seeking something. What? Stubborn. No, egoistic will not. Why egoistic will be like that? Egoistic like that. Why will the head fall backwards? Why will it fall left side and why it is right side? Left side is what? Left side means sensitive. More of sensitivity. So, if it is contracted towards left side means what? and contracted on right side means what? Anyway, when you come to SCPH, we'll talk about it. So this is what is happening. The head is too heavy and she's trying to take up the head. Let us see the history of this child. Mother's history. Go for mother's history. Yes, please read it. So cannot sit for a long time, jumping, climbing upstairs. Downstairs not possible. She could not jump, climb, walk, nothing. Running not developed because all the muscles were very weak. Child, while standing, unable to hold the head, hold the neck, head. So it would not even remain on its place. Pain at the anal region and itching and redness at anal region. What is pain at anal region again? Anal region stands for shit. So if somebody has treated the mother like shit also. Everything points out to that only. Next. This was, as I said, that white matter frontoparietal region which likely represent terminal zones of myelination. So demyelinating disease. This is a demyelinating disease, and that's why probably they said it could be even from metabolic disorder. But something has happened inside. We are not bothered about the pathology here. Go ahead. Cried immediately after birth. Delayed in holding head, turning. Any child who is holding the head late, find out the mother's position of esteem during pregnancy, where it has been hurt. Pregnancy of history of mother, you say?
Whole 9 months of pregnancy, she had leg pain and taken massage in electric vibrator machine. Because of joint family, she was unable to go out with her husband. During clinical checkup, she was always forced to go with her mother-in-law. Her mother-in-law did not allow her husband to be near her or accompany her. This gave rise to anger on her mother-in-law. Anger was not expressed. Reaction was weeping, but only when alone. She was an introvert and never expressed openly. Physical generals of the patient: she was lean, thin, fair complexion. Hunger she could not tolerate. She gets angry when not fed in time. Anger causes redness of face. If food is not given on time, no preference of hot or cold food. She desired chocolate, jelly, sweets, ice creams. She had aversion to spicy. She was chilly and thirstless. Perspiration profuse more on the face. Stool, she had no control.
So anyway, what was the cause here? Again, we can tell the cause better than the patient also. We can predict the cause. That somebody has not allowed, given her proper respect. She has been treated treated badly. What was the reaction of the patient? She was very angry, and her anger was not expressed. Now, one more in this child's case, one more syphilitic symptom was there, that she had involuntary stools. Stools used to pass involuntary. Again, neurogenic only. So that anus was affected, as I told you. Anus also, there was no control over the anal sphincter. So, two things have occurred here, that the effect on the child, this child, is that head cannot hold and rectum also cannot hold. So she passes involuntary stools. And ailment from mother was what? Anger, which was suppressed. We just plainly combine these two and see what is the remedy coming. Three rather. Put it up. We have Ignatia, Natramur, Staphysagra and Semonium. Ignatia, Natramur, Staphysagra and
अरे उठो उठो उठो
after 3 months.
डोकं तिचं खाली असतं
म्हणजे ही मान खाली जाते फक्त उठताना बसताना तापताना
मांडी मार के
मांडी घालून देतो
मांडी मार के
After
बैठो
6 months.
अभी उठ के बैठा अरे वाह ऊपर देख हाँ
उसको सपोर्ट
अप डाउन ऐसे ऐसे अरे वाह
और ऊपर
थोडं दूर रहणं म्हणजे दिखे बचे आगे आगे नको जाऊ उठे कर अप डाउन
अरे वाह.
और ऊपर
अंशु मार देना
फटाफट. अच्छी होती है.
वापस मम्मा
She was not able to walk, run, jump, everything came. And this progressive disease, demyelinating disease, is gone. Only because we neutralized her mother's emotions. Just imagine how much mother passes on to the child. So those who are going to get married, again one more piece of advice. Select a good partner. More than partner. You all believe in the horoscopes and all? Horoscope? Yes or no? You match the horoscopes? Then you should match it with the mother-in-law. Because you are going to be with mother-in-law. Husband will be away. Okay, so with this I think if you want to ask any questions, please shoot. That is the pathology.
Sir, rubric in general head falling forward is taken, but not pathology is not taken into consideration. Sir.
But that is the pathology, no?
So anything related to muscle or any demyelination like that?
See, you cannot take general pathology because all muscles are not affected.
Okay. Only
it was the neck, no? Yeah. You saw that she could get up from here, but then she could not hold this only. That was more peculiar. Why only head? It was not here. Generally it is the, what do you call it, any myopathy starts from here. That they can't walk properly and then this becomes weak. It's the other way around. So that means you have to attack the head only. XYZ is diagnosis. Yes?
Sir, actually when miasm is bloom, we are told not to consider the causative factor. But when the miasm is in bloom, no need of considering causative factor, but here we consider the causative factor.
As I told you yesterday, no, you have to see the cause-effect relationship in case of pathology of birth. So what is the meaning? This is not the direct causative factor of the child, but the child which is being influenced by ailment from anger suppressed. That suppressed anger causes adrenaline to go into the blood. This adrenaline is going to cause this problem to this child. So we have a constitution which is affected by. Like when you are taking Thuja for vaccination, it is not Thuja for vaccination. The constitution which is affected by vaccination, Thuja can be one of the remedies. You understand that? So, if some glass is broken, that means it is brittle and it can be, if you strike, it can break. So it explains the constitution of that child or that particular person. In all yesterday's cases, we have taken ailment from of the mother, not of the child. Because this is not the child's defense mechanism. It has started right from mother's trauma was there. So why did the child get traumatized inside this thing? Because it could not tolerate. If there are two pregnancies, twin pregnancies, if there is a twins, one child who has got the mother's tendency will inherit. The other, if he is a rebel, will not inherit. You understand? So this clearly means that there is a difference of action. I hit here and I hit on a glass. It will be reaction will be different. So what is important? Hit is not important. Reaction. So what has affected this child is that. If there was another child, wouldn't have been affected. It could have been mercury. Yeah.
Sir, I want to ask one question, not related to this case. Sir, what is the importance of inimical remedies? What is the importance of inimical remedies?
What is the
importance of inimical remedies?
Inimical remedies.
क्या चेंज लाते हैं वो, और वो ऐसा चेंज क्यों लाते हैं कॉन्स्टिट्यूशन में पर्टिकुलर?
क्या सेकंड बोला? What?
क्या चेंजेस लाते हैं बॉडी में और वो चेंजेस आते क्यों?
नहीं, inimical remedies means remedies which are almost similar but slightly different. You know, so they appear to be like causticum and phosphorus. They are appearing to be almost similar, but when they are given, suppose after causticum phosphorus is given, it will cause antidoting of that causticum. Whatever good work has been done can be neutralized by the other remedy. That's why they call it inimical. Like if sulfur has been given, then don't give Lyco. Then there is an interposing remedy like calcarea, and then you go to Lyco. So they have a tendency of neutralizing the effect of the previous remedy, correct remedy.
And any suppression or side effect?
हाँ?
कोई suppression वगैरह करता है?
नहीं, suppression not suppression.
Sir, if in a given case the patient says someone has done black magic on me,
on you?
Like
patient or you?
Says, patient. Sir,
patient says that somebody has done black magic.
Magic on me. In those cases, what kind of rubric we can take?
You want rubric? Going straight to okay. Take for instance, now what is the first thing what I am trying to tell you is that you be in the patient place. And if you feel that black magic has been performed on me, means what?
Delusion.
It's a delusion.
Yes, sir.
That I am not in my proper senses. That I am having an apparent understanding. It's an apparent understanding.
Yes, sir.
A false perception that somebody is trying to do something bad to me. So delusion that, so how many delusions can come in here? There's not one. So 5, 6 this thing will get. Yes? Huh? Delusion persecuted is one. Then delusion being possessed. Second.
Okay,
Who is possessed then? Third, conspiracy
Yes, sir.
against me. One more. I, under superhuman power, somebody is ruling me.
Yes, sir.
What else? Yes? So many are there. So you have to prove all this.
Okay, sir.
What do you mean by being possessed? They feel that I am being possessed or somebody has done something on me. What is the exact meaning? You have to go into details and ask. What is that? Now there are certain people who do like a have you seen that?
Yes, sir.
Huh? Devi. So this is delirium. This is not delusion. This is a delirium. That delirium is something which is based on a delusion. That a supernatural power has gone into me and now I am goddess. That delirium, that I am God, that God has come to me, etc., etc. This is delirium. So that is a delirious state. Huh? What? What is that? Trance.
It is trance position.
So, trance, ideally speaking, has something where he is oblivious of what is happening. In trance, there is something which is where the patient is oblivious. He is not aware of what is happening. He goes into a trance. Yeah. Whereas in delirium, they are aware actually. You frighten them, they will get out of it. Then there is something like even feigning. In order to attract people's attention, feigning also. So these things are 2 or 3 different things. As he said, she could be in trance and sitting like that goddess has come. Or there is a people who are feigning to frighten others, that you give me this, give me that, then I will do something for you. So these are various things which you need to probe. But it is a disorder of the mind.
Sir, this question is regarding yesterday's case of multiple fractures. Carcinosin has given. So I want to ask, what will happen? Already he has put multiple rods inside his body for big fractures.
So
after carcinosin, what will happen with those rods?
Yeah, within 3 years, 2 to 3 years time, we'll remove all the rods.
Okay.
Because this thing is becoming fatter and thicker.
Yes, collagen is going to develop after the carcinosin. So
has already, no? He says now they are becoming rounded, bigger, he is getting shape.
Okay.
And he started increasing in height. If collagen was not being synthesized, how can he increase in height at the age of 17 years, 16 years?
Thank you, sir.
Staffy Sakriya, during the process of recovery, he is developing some acute symptoms. It may be simple cold, starts from anything, GIT disturbances. At the time, how you are going to manage? Already Staffy is working.
See, generally when a major disease is reversing, major genetic disease is reversing, that time smaller diseases are bound to come, illnesses, because syphilis is going away, so it's bound to develop some soric complaints like fevers, diarrhea, dysentery. If it is not life-threatening, just manage it with, like if he's having a lot of diarrhea, manage it with excessive hydrolysis, what you call as water and limbu sarbat and whatnot. I prefer not to give electrolytes. You know? Not artificial electrolyte, but normal, natural. If it is life-threatening and not everything, then a remedy which is in relation to Staphysagra will be indicated. Then you have to give that particular remedy.
Sir, we have been following you since many years, and previous seminars which we have attended, there was a lot of importance given to mentals and thermals, especially. But yesterday and today we are seeing less importance given to this too.
Very good question.
So,
see,
what shall be done?
This is that. I have been training people from SORA, psychosis to syphilis. When we are talking about physiological illnesses and physiological prescription, it is very important that we do not miss the thermals and thirst, because that is also physiology at work. You understand? Even that time, ailment was important. Mental, because mind is also physiology. Yesterday you must have heard me telling that mind is less important. Isn't it? We have graduated to that level. We are talking about a limitless scope. What 2 days we are showing you are cases which are not ordinary cases. They cannot be taken as physiological. They are all pathological, structural, destructive, where genes are involved. Tell me which genes are telling you about thermals and thirst. Genetically, as I told you, the first 4 months, it is the genetic code which is taking care of you. Later on, vital force joins it. And third part is when he takes birth. These are 3 different stages of human beings. You understand? When you are going towards, suppose a newborn child, then thermals become important. Now today I took important. Chili, thirstless, isn't it? But when you are talking about genetic problems, mutations and all, no thermals were developed that time. Yes. That time when mutation took place, there was nothing like that. Inside the womb, the child is not hot or chilly. Only when he is come out, he becomes hot or chilly, depending upon his reaction to the environment. You understand now? In physiological conditions, it is a must. All my books I have mentioned, and I always follow that. But when it goes to a condition which is irreversible, where genes have to be tackled, thermal thirst are not important. We are going beyond. Absolutely right. Absolutely right. Yes, so should we call it a day?
No, sir. So, in a case, the baby is operated for VSD at 4th month, 4 months of age. A baby has been operated for VSD in 4th month. Yeah. And he develops hypoxic state after that operation.
After that?
Hypoxic injury of brain.
What did he develop?
Hypoxic injury of brain. So he is getting convulsions and put on Valium and all. So which point has to be taken in this? How to approach this? Mother's mental state during pregnancy doesn't matter in this?
Of course.
So which point has to be considered?
Everything which is happening has to have the origin somewhere in the mother, because the child is hardly 4 months old, isn't it? Things happen. Things happen to give an expression of what the mother was thinking. Now, if this child has gone into what? Mental retardation or cerebral palsy? Cerebral palsy, isn't it? Yeah. So, somewhere, now what was it? What was the condition? This or what? total relaxation. Now can you tell me one thing? That total relaxation is due to what? Elastin not forming properly, getting synthesized properly. What was the, tell me the pathology of the VHD. Give this thing, no, please. Very nice point you have raised, no? That's why let everybody hear. Has the disease changed? Disease has not changed. The disease has not changed at all. So that's why you have to understand what Hahnemann has said. Try to cure. First of all, understand that he has to understand what is the disease in man. Aphorism number 3. Then, what is curative in medicine? So, knowledge of the disease. So, what are you searching here for? Body is always trying to express itself and shout hoarse, I am having this deficiency. This thing which is not closed is not destruction, mind you. VHD is not destructive disease which people think about. It is like a big, this is a knit. The whole thing is knit like that, and the elasticity is not at the end of the pregnancy, almost end of the term, it starts getting tougher and closes. You must have read this, no? In your books, isn't it? So, the fibrin, the elastin, they have to become tough and close the compartmentalize and do the compartmentalization, isn't it? But in this case, elastin was less from there only. So, my presumption is that the mother somewhere has not received love, and finally she has given up. Probably she has even seen some of the husband loving somebody else and not her, and she is helpless. I can't help it. So this legs and hands giving way are not able to, the child is not able to use it properly, means that elastin synthesis was lacking before only, and you have suppressed it, it has gone higher up. The body shouts and tells you that you have not treated the cause, you have treated the effect only and closed it. Do you understand? Try to probe in this direction, you'll get the problem.
With this, we are going to end our session. Predictive homeopathy is not something different. It is same Hahnemannian homeopathy.
What? I could hear.
The same Hahnemannian homeopathy. Sir had to give it a name, predictive, was only to emphasize that what Hahnemann meant by homeopathy was a science of therapeutics which was mathematical and predictable. If you practice homeopathy rightly, you get invaluable and predictable results, since called predictive homeopathy.
A good teacher explains, a superior teacher demonstrates, and a great teacher inspires. Sir, you inspire us. As a token of our gratitude, we invite Dr. Semparathi, President of Happy TN, to present a memento to Dr. Prafullu Vijaykar, sir.
If I have been able to give you something which you have treated as an inspiration, don't keep it within you. You'll get suffocated. Do expiration also. Whatever you learn, give it to your friends. Just imagine what would have happened if Hahnemann would have kept all knowledge to himself only? He has written that. Do you know in Theory of Chronic Disease introduction? He has written these words, that if I were not prudent enough, he has written this word, prudent enough, and I would have kept all the knowledge to myself, whole humanity would not have benefited. Similarly, I am telling you, if I would have kept this knowledge to myself and not given to anyone, I would have got all the cases for me. But then it is not spreading. We want this beautiful science, which is a real science in strict words. This is a real science of medicine which has to spread. You have to go and communicate and give others also. You be strong and you give it to others also. And make them strong. Because all may not be fortunate to understand within one shot. Let me tell you. All may not be fortunate. People who are coming here again and again and again, they are not fools, they are wise people. Because more you listen, more you hear, the more ideas develop. Similarly, Organon, please don't leave Organon on any accounts. Go on reading it so many times, and every time when you read, you will get something new out of it. Remember, Organon is like a Bible, like a Quran, like Gita, or like Grantha Sahib. And it has no depth because it has got philosophy which can never die. The same philosophy will be true whether it is on Moon, Mars, Saturn, or anywhere, wherever you go. Philosophy will never change. So, I again and again request you, treat that Organon as God and learn from it every day, because it is the direct thing where Hanuman is in connection with us. And you have to be in connection with the founder from here. Then you will see the results which you get. Fantastic results. Thank you. Destruction.
We request Dr. Jawahar to present a memento to Dr. Ambarish Vijayakar. Sir, kindly open it, sir.
Yes. Oh.
Sir, one more award you have to give, sir. This honor arranged by a professor of this university, Dr. Swaminathan.
Yes, sure. Specially designed.
Thank you.
Oh. Ah. This is Wimbledon, eh? Nice.
Every king actually giving the gift to masters.
Okay. Thank you.
We would also like to invite Dr. Prabhakar Vaidyanathan to present a small memento to Mr. Tarang Vijayakar. The person behind in us getting this beautiful ambience is Dr. Professor Swaminathan. Dr. Swaminathan is currently working as a professor in Information Science and Technology, College of Engineering, Guindy. He is the person behind in getting us this elegant ambience. We now call upon Dr. Swaminathan to the dais to receive a memento as a token of our love. Sir, kindly do the honors, sir.
Thank you so much. Thank you so much for giving us such a beautiful day. Thank you so much.
Thank you, sir. There is salvation for faltering on any virtues, but not for ingratitude. I invite Dr. Iyango Subramanian, Secretary of Happy TN, to show our attitude of gratitude.
Good evening. Guruvarga, Guruvetunai. I know you all are in flight mode, so I will not take much of your time. Please bear with me. So this is a routine one. So in 2007, we started going for the predictive seminar. Since then, we have been requesting sir for the seminars. Every time when we go, sir used to say, "You are two people, how will you manage?" So till 2016, we have been able to get it. But when we went to last year, sir did not say anything, directly gave the dates. But we were shocked to see the results in 10 days. We have to pre-close the bookings. So that was the result which we have got it. That is because of the practical homeopathy has reached the mass even before we think that it has not reached to the colleges well. But it was the sir's intuition which gave us a good response from the colleges as well as the doctors and practitioners. In Tamil we say, like, Tottanai Thooru Manakkeni Mandakku Kattanai Thooru Marivu. It means water will flow from a well in the sand proportion to the depth in which it is dug, and the knowledge will flow from a person proportion to his learning. So we saw that sir's vast knowledge in human sciences, embryology, evolution of species, genetics, and immunology. We show that with this vast knowledge, we have gained so much in these last 2 days, which will be helpful for us in our life. So we assure sir and promise us that we will take care, will reach us to the masses and will share, as sir suggested, will share everyone so that the right homeopathy reaches every homeopath in the world. So that will be our aim too. That will be the Guru's darshana from us, so that the sir's dreams fulfill us. Thank you, sir, for giving us an opportunity to take to the homeopaths. Dr. Amrish, and we have been seeing sir from last 7-8 years, and with this so much of encouragement, he has advised us and conducting these seminars, so many advices he has been giving it in the last 2 months. With this guidance, we could conduct this seminar in a well manner. And Mr. Tarang, Director, Predictive Homeopathy, and Dr. Akshudha, Predictive Homeopathy, both of them has helped us in going on well this seminar. Also, Dr. Jnana Prakasam, who has accepted in the inaugural session and inaugurating the seminar, he has come all the way, though his age, when we requested him to come for the seminar for inauguration, he was happily agreed that I will come, and also he gave us a valuable tip in case takings in his inaugural address. Thank you, sir, for your valuable advice. Also, the Dr. Murugan, who has addressed the gathering with the inaugural address. Thank you, sir. And with this, a special thanks to Dr. Jnana Sambandam, former TN Tamil Nadu Medical Council President, and also editor of Homeo Times, who has helped us in organizing this event in a well manner. Also, with this, I give a special reference thanks to Dr. Shoysen and Dr. Lazar, who has been always encouraging us, go to the sir and get for dates so that you'll get it. So every time we used to say, when we are lagging behind this, you go to the sir, you ask him. He is the one who was motivating us in the last 2 years. That especially say, I from the wholeheartedly, I say this sincere thanks to both of them who was encouraging us to bring this mega event. Also, Dr. Vijay Krishna and Dr. Muthuramalingam sir with selfless residence has helped us in organizing this well event with the good masses of students who are benefited most in these sessions. So this is going to be a live event for them. So this is the one which we are expecting it. Also, in the last few years, we have been going to all the medical colleges in the Tamil Nadu, homeopathic medical colleges, to spread the predictive homeopathy. Whenever we have requested to them, principal or the management, we have never been refused. We have given time. We have given time, and we have spoken in all the colleges in the last 2-3 years, almost half a day, full day. They have, without any hesitation, the principals have gave us. I sincerely thank them in this time that we will continue to expect the same patronage which we have received it, so that the students get benefited most from the sir's teachings. Thank you, sir, for all the seminar, all the help which we have received from Professor Swaminathan sir, who have been helping in getting this prestigious university's space for the seminar. So that was very easy for us. Initially, we have been running around to get the seminar hall, but that was with one moment of call. We got everything here, food, everything, ambience, everything, with the one phone call, which really feel thanks to him, sir. And the last, also the canteen and mess management team who have helped us in giving a delicious food. And the last, and not the least, the Pandya-Raj who has designed this logo for us. Also, we thank the delegates who have come from all the parts of the world, Sri Lanka and all the parts of Tamil Nadu, North India, Delhi, Punjab, Gujarat, Odisha. Thank you all, Telangana, Andhra, Karnataka. So it has become a pan-India presence here in the first time in the seminar, which we could do it only with your help of it. Also, we will not forget the students who have come from all the states from Karnataka, Andhra, as well as Tamil Nadu, though it is a very distant from Kanyakumari, they have come all the way along in the last with the short notice. Definitely after the exams, when they are just after the exams, they have come here with the good motive of learning. Take this to share to your friends. We'll be thankful to you all for this. And the last, not the least, the whole team. We were almost 50 to 60 people who have been successful behind us to bring this seminar. Almost, I cannot name in this, it will take me a big mass here. So I thank one and all for this good patronage which they have given it in the last 2 to 3 months. Thank you one and all. Thank you.
We now call upon Dr. Muthuramalingam, Principal, Hahnemann Homeo Medical College, to receive a special memento as a token of our love. Sir, there were close to 150 students from this college attending this seminar.
Thank you very much. You have done a great job. Bringing 200 people.
With this, we come to the end of this 2 days seminar. Kindly rise for the national anthem. Thank you, one and all. Participating students, kindly.
3 cheers for Hanuman. Hip hip. Hip hip. Hip hip.